Comme nous l'avons annoncé le 30
we
novembre
announced on
dernier,
November
nous sommes
30th,
en train de graduellement
we are
augmenter
gradually
notre
increasing
capacité de
our
tester
capacity
les
to
voyageurs
test
à leur
travelers upon
arrivée
their
aux
arrival at the
aéroports canadiens.
airport in Canada.
As announced on November 30th, we are gradually ramping up our testing capacity at international airports. Today, I would like to provide you with a brief quantitative update of that increasing testing capacity. On November 30th, our capacity for all air travelers from all countries was of 11,000 tests per day. As of yesterday, December 9th, that capacity has increased to 17,000 tests per day. The end state to test all non-US air travelers is a capacity of 23,000 nationally. We are therefore halfway. At the Vancouver International Airport, we've gone from 2,080 tests per day on November 30th to a capacity of 3,130 tests per day on December 9th. At the Calgary International Airport, we've gone from 910 tests per day on November 30th to 1,460 tests per day on December the 9th. At the Toronto Pearson International Airport, we've gone from 5,232 tests per day on November 30th to 8,317 test capacity per day on December the 9th. At the Montreal Trudeau International Airport, we've gone from 2,128 tests per day on November 30th to 3,033 tests per day on December the 9th. Je vais maintenant répéter tout cela en français. En date du 30 novembre, notre capacité de test aux aéroports canadiens, capacité totale pour tous les voyageurs aériens de tous les pays, était de 11 000 par jour. Nous en sommes maintenant à une capacité de 17 000 tests par jour, une augmentation d'un peu plus de 50 %. La capacité nécessaire est de 23 000 par test pour tester tous les voyageurs aériens de pays autres que les États-Unis. Nous en sommes
than the United States, which means we are halfway.
À l'aéroport international de Vancouver, nous sommes passés de 2080 tests par jour en date du 30 novembre à 3130 tests en date du 9 décembre. À l'aéroport international de Calgary, nous sommes passés de 910 tests par jour en date du 30 novembre à 1460 tests en date du 9 décembre. À l'aéroport international Pearson de Toronto, nous sommes passés de 5232 tests par jour en date du 30 novembre à 8,317 tests en date du 9 décembre. À l'aéroport international Trudeau de Montréal, finalement, nous sommes passés de 2128 tests par jour en date du 30 novembre à 3033 tests par jour en date du 9 décembre. On le voit, notre capacité de tester augmente de manière significative, mais elle demeure encore incomplète. As you can see, our testing capacity is increasing steadily and significantly, but it still remains incomplete. In order to further increase our capacity quickly, we've awarded contracts to private companies, providing us with additional testing and processing services. These companies include Switch Health, Life Labs, and Dynacare. Ces compagnies vont nous aider à augmenter notre capacité à tester les voyageurs à l'arrivée jusqu'à ce que nous puissions tester tous les voyageurs ciblés comme nous l'avons annoncé le 30 novembre dernier. Once again, to anyone who is planning to travel, I will say this: you need to plan ahead. Be prepared for airport delays, have a quarantine plan, and be sure to use the ArriveCAN application or website to submit your information before you arrive at the Canadian border. You should also be prepared for officials to follow up with you to make sure your COVID testing is complete. The goal of these measures is, and always has been, to protect the health and safety of all Canadians. Par ailleurs, mercredi, j'ai tenu une autre rencontre avec mes homologues des provinces et des territoires afin de les informer de l'évolution de la situation. On Wednesday, I met with my provincial and territorial counterparts and provided them with another update on the ongoing situation. Over the course of the pandemic, our government has made significant investments in order to build testing capacity with the provincial and territorial healthcare systems. Through the Safe Restart Agreement, we have transferred over $3 billion to provinces and territories for testing and contact tracing. The federal government has also purchased 95 million rapid tests and shipped 86 million rapid tests to provinces and territories. Depuis le début de la pandémie, notre gouvernement a réalisé des investissements significatifs afin de permettre aux provinces et aux territoires de développer davantage leurs capacités de dépistage et de traçage. À travers l'entente pour une relance sécuritaire, nous avons directement transféré plus de 3 milliards de dollars aux provinces et aux territoires. Le gouvernement canadien a également procédé à l'achat de 95 millions de tests rapides, dont 86 millions ont été livrés directement aux provinces et aux territoires. Comme vous le savez, toutefois, les demandes des provinces et des territoires pour ces tests rapides ont augmenté dernièrement rapidement. Pendant plusieurs mois, ces tests étaient largement sous-utilisés, mais pour le mois de décembre, les provinces souhaitent en recevoir autour de 35 millions. Cela représente à peu près 5 fois la quantité moyenne de tests utilisés au cours de la dernière année. Il s'agit d'une excellente nouvelle et comme nous l'avons toujours fait depuis le début de la pandémie, nous allons répondre aux demandes des provinces et des territoires et nous assurer que ces tests soient livrés à temps pour la période des fêtes. As you know, provincial and territorial demand for rapid tests is growing. For the last year, these tests were largely underutilized, but for the month of December only, provinces and territories have requested around 35 million tests. This is very good news, and we will ensure that provinces and territories get these tests in time for the holidays. Finally, I would like to take a moment to come back to the National Advisory Committee on Immunization's recommendations from last week. As clearly stated by NACI, booster shots are safe and an effective way of enhancing our collective level of protection against the virus. I encourage all Canadians to get a booster shot as soon as it is possible. In our meeting on Wednesday, I reassured my provincial and territorial colleagues that the federal supply of vaccines is ready and available for them to use. Finalement, j'aimerais revenir rapidement sur les recommandations du Comité aviseur national sur l'immunisation. Tel que clairement indiqué par le Comité, les doses de rappel sont un moyen sûr et efficace d'augmenter notre niveau de protection collective contre le virus. Tous les Canadiens âgés de plus de 18 ans peuvent maintenant commencer à recevoir cette dose de rappel dès que possible, conformément aux recommandations du Comité. In closing, I want to take a brief moment to take stock of the formidable progress we've made over the course of the last 20 months. It's been tough for all of us, et nous ne voulons pas revenir en arrière. The Omicron variant of concern is a cruel reminder that the global epidemiological situation can change quickly. We all need to be prepared for that as well. At any given time, we may need to change gears, adjust our plans, or change our behavior to meet the needs of the moment. That goes both for individual Canadians and for their governments. Canadians who are thinking of traveling abroad need to be warned that the situation abroad is both risky and unstable. They should also know that returning to Canada will likely involve delays and hassle. Je vais maintenant me tourner vers vous pour toute question ou commentaire avant d'aller vers la présentation du docteur New Dr. New and Dr. Tam's presentation.
Thank you very much, Minister Duclos. As you mentioned, Minister Duclos will be taking questions for about 30 minutes. Then Drs. Tam and New will present the modeling, and then they will take questions specifically on the modeling. Those who in the room who would like to ask a question will go to the microphones, and then after that we will go to the operator and people joining us by phone. First question, and when I call on you, can you tell me your name and your media organization? Mike to my right.
Bonjour, Louis Blouin de Radio-Canada. Monsieur Duclos, j'aimerais vous entendre sur les cibles de dépistage dans les aéroports. C'est quoi votre objectif? Quand aimeriez-vous avoir atteint ce 23 000, ce chiffre de 23 000 tests par jour?
Très bien. Je rappelle rapidement où nous en étions et où nous sommes et où nous devons aller. Donc, nous étions, lors de l'annonce, à 11 000 tests dans
at
tous les aéroports
11,000
canadiens
tests in
pour
all
tous
Canadian
les
airports
voyageurs, y
for
compris
all
ceux qui viennent des
international travelers,
États-Unis.
including
Nous
those
en
coming
sommes
from the
maintenant à
United States.
17 000,
Now
donc
we
une
are at
augmentation d'environ
17,000, so it's about a
Et nous avons besoin
50%
d'atteindre le
increase,
23
and
000
we
le plus
will
rapidement
need
possible. Et c'est
to
pour ça
reach
que
the
les
23,000
informations
per
que
day
j'ai
as
données il y a
quickly as
quelques instants
possible,
sur les
which is why I
opérations
gave that
d'approvisionnement auprès de
information
fournisseurs
on
particuliers vont nous aider à
those three
atteindre
companies, which will be
ce seuil de
helping
23 000
us
aussi
to
rapidement que
reach
possible.
that
Ce que j'ajouterais, c'est
$23,000
que ces
threshold as
chiffres
quickly as possible.
n'indiquent pas peut-être totalement
Those figures
l'importance
might
des
not be
progrès
completely
qui
indicative
ont
of
été faits
all
au
of the
cours des
progress that
derniers
has been
jours.
made
Alors,
over the
si je
past
peux me permettre,
days,
là,
because
comme vous
if I
savez, j'aime
may,
beaucoup les chiffres.
as you
Donc,
know,
le
I
11
love
000, c'est
numbers.
la somme de tous
11,000
les
was
tests faits
the
dans
sum
les aéroports
of all
canadiens.
tests
Mais
in
de
all
ce
Canadian
11 000,
airports.
il y
But
en
of
a
that
à peu près 3 000
11,000, about
qui étaient
3,000
spécifiques aux
were
voyageurs
specific
aériens
tests
d'autres
for
pays que
air
les
travelers from
États-Unis. Et
other
c'est sur ces
countries
voyageurs-là
than the
que
United
nous
States.
investissons nos
And it is for those
efforts dont
travelers
nous
that
sommes
we are
partis
investing
essentiellement d'une base d'à peu près
efforts.
3 000
We went
et
from
nous
about
avons déjà ajouté
3,000,
à peu
and we
près
have
6
already
000 à
added
cette base
about
de 3 000, ce qui est une
6,000 to
augmentation
that
très
basis of
significative. Il nous
3,000,
reste
which is
un
a
autre 6
very
000 à ajouter
significant
pour atteindre
increase.
le résultat
And we
final.
will keep working to meet the final result.
Donc, est-ce que là-dessus, j'aimerais savoir, est-ce que
Follow-up
vous visez une
question.
question de jours, de semaines,
So do
de
you
mois
know,
pour en arriver
as
là?
a matter of
Deuxième
days or
question,
weeks or months,
il y a
when
un
that will
changement de
happen?
dynamique que pourrait amener le variant
There has
Omicron.
been
On le
a
sait,
change in dynamics
il y a des scénarios qui
with
vont
this
nous être
Omicron
présentés.
variant.
Il y a des gens qui sont en train de planifier le party de Noël. Il y a des
People
gens qui sont en
are
train de
planning
décider s'ils
Christmas
annulent leur
parties.
voyage dans le sud.
Some are
Votre
deciding whether or
message,
not they
c'est quoi
should
à la lumière du
cancel
variant
their
Omicron?
trip down
Est-ce qu'on
south.
rapetisse les fêtes de
What
Noël?
is
Est-ce
your
qu'on
recommendation?
évite
Should we
de se
avoid
déplacer? Est-ce que vous pouvez envoyer
traveling
un
or
message clair
gathering?
là-dessus
Can you send a clear
sur ce que vous
message on that
conseillez?
point?
Mais
What do
deux
you
choses ici. La première,
advise?
sur la situation
Answer.
au Canada, vous allez voir, évidemment, dans quelques instants, lorsque
In a
les
few
docteurs
moments, you
Tam et
will
New vont nous
hear
donner
from Doctors
pour
Tam
le
and New
portrait actuel et
on the
prochain.
updated
Et
modeling
là-dessus, bien, on
and
sait
the forecast as
qu'on
well.
observe là, que les cas actuels,
We're
y compris
observing
au Québec, là, ce sont des
that
cas reliés au
cases,
variant Delta. Et le
current cases,
variant
including in
Omicron
Quebec,
est
are
pour
mostly
l'instant
with the
très peu
Delta
présent au
variant.
pays. Mais ça,
Omicron
c'est parce
is
que,
still
entre
very
autres, là,
rare in
évidemment,
Canada.
nos opérations à la frontière
And of course, that
avant
is
l'arrivée et
thanks
après
to
l'arrivée
our measures
fonctionnent.
at the
Elles sont pas parfaites,
border.
évidemment.
Of course, our measures are not perfect. We're
Les tests
hoping
sont
that they
imprécis,
will
donc les
work.
gens
And
peuvent quand
testing
même
is
transmettre
sometimes
le
inaccurate,
variant quand
as we
ils
know.
voyagent au pays en raison de l'imperfection des tests.
And since
Et
tests
donc,
are
c'est comme ça.
imperfect,
Mais
travelers
la
can
situation,
still
donc on a à peu près
contribute to
80
the spread of this
cas
virus
d'Omicron
in the country,
au
but
Canada.
there
C'est pas ça qui,
were
évidemment, là,
approximately 80
explique
cases of Omicron in
les
Canada
augmentations
at the
importantes
last
de cas
data.
à tous les jours au pays.
And
Alors, ce
this
sont
can
des mesures de
help
santé publique
explain the
habituelles
significant
pour
increase
limiter
in
la
tests
transmission
that we
communautaire qui
have
sont
been
importantes.
seeing in
Évidemment, au
Canada.
Québec, on a présentement le
Quebec,
taux de nouveaux cas le plus
currently,
élevé
we
au
have the
pays.
highest rate
Le
of new
gouvernement
cases in the
du Québec
country.
fait son travail
The
correctement.
Quebec
Nous
government
rassure en nous
is
disant que
doing its
le
work
taux d'hospitalisation est
properly. We're
sous
aiming to
contrôle
ensure
essentiellement, mais il
that
faut être évidemment
hospitalization rates are
vigilant
under
parce que
control, but of course we
il y a
must remain vigilant
généralement un certain délai entre la transmission et
because there is
l'évolution des
generally a
maladies et
delay
donc des
between
hospitalisations.
the
Ça, c'est sur
transmission
le
of the
plan
virus and then
domestique.
later
Sur
we
le plan
see the
international, la
increase in rates
situation
and
évolue
hospitalization
très
rates.
rapidement. Et c'est ça que mon
Outside of
message principal
Canada,
aujourd'hui, c'est pas
the
c'est
situation
plus
is
sur la
evolving
situation
very
internationale.
rapidly.
Les
That is why my
voyageurs, les gens
message
qui
is
pensent
mainly
voyager,
regarding the
dans les
international
prochaines
situation. My
semaines,
message
doivent
is to people
savoir
who are
que
planning on
à
traveling in
l'échelle
the coming
internationale, les
weeks.
choses peuvent
They must know
rapidement
that around the
changer.
world things
En Europe,
can
si vous
change
suivez un peu les chiffres,
rapidly. If
ça
you're
devient
following the numbers
très
in
compliqué dans
Europe,
plusieurs pays.
it is
Des pays
getting
même
very
qui sont en train de demander
complicated
aux
in a
élèves de
number
rester à la
of
maison
countries.
parce
Certain
que la
countries have
situation se
even
détériore
asked
trop rapidement.
school children to stay at
Dans
home
certains
because
cas,
the situation is deteriorating too quickly.
On invite les gens à faire du télétravail alors qu'ils avaient commencé
In
à
some
retourner
countries,
au bureau.
people
En
had
gros, ce que
started to
j'essaie de
go
dire,
back
c'est
to
que
work at their office, but they
internationalement,
have
c'est
been asked to
critique.
stay home again.
En peu de temps, ça peut évoluer. Et ce que j'essaie de
Things
dire aussi
can
aux
evolve
gens, c'est
rapidly,
important
and
qu'ils
what I
comprennent,
also
c'est qu'au
try
retour au
to
pays,
express to
les choses
people
aussi
is that
peuvent
when people
évoluer
are trying to come
rapidement.
back to
Et ils
Canada,
doivent s'attendre à
that
ce que
is
ce soit
also a time when
beaucoup
things
plus
can change
compliqué
very
de
quickly,
voyager à
and they
l'étranger
must
et plus
expect
compliqué
that
aussi de
things
revenir au
are going
pays
to
avec
get
les
more
tests
complicated when
et
it
les
comes to
quarantaines
traveling traveling abroad and also coming back, and we are putting certain quarantine measures in place.
Saying good morning, Minister Duclos, Krisanashkate, CTV National News. Minister Marcy Ian is self-isolating at home after coming into contact at a gala in Toronto with people who have since tested positive. Should MPs and cabinet ministers be attending these large events given the rise in case numbers? And have you had any contact with her on Parliament Hill this week, either in the House or at caucus?
Well, the answer here is that every Canadian, and certainly all parliamentarians, need to abide by the public health measures. Obviously, there are people who would naturally be more exposed to more people, and that's certainly the case of parliamentarians and public officials, including journalists. But whatever our role is in society, we need to be following public health advice. And when there is a risk or a likelihood that we have been in touch with someone infected, we absolutely need to follow the right public health guidance.
You haven't been in contact with Marcy Ian at all?
Well, I will have to check the details of that story, and I can come back to you.
It costs around €1 for a rapid test. In Ontario, it's $40 at Shoppers. Are you disappointed that provincial governments have not made the rapid tests you've given them more affordable and available for Canadians?
Well, we know it's been challenging for provinces and territories over the last year, and there's certainly no intention for me and for us here at the federal level to blame anyone. Experts have, however, said that we could have used rapid tests more often. This being said, experts also tell us that these rapid tests need to be used in a particular context, in a particular manner, in order to understand what they really can and cannot do. And two things that rapid tests can do quickly, and therefore things that rapid tests cannot do. The two things that rapid tests are quite good at is to provide what we call surveillance activity. So if in an environment like a school or hospital, a community center, a factory, there is no apparent sign of COVID-19, but we still want to be double certain, because it's a large community, then rapid tests are useful because they screen a lot of people rapidly, and they get very ample results of whether there might be community transmission or community occurrence within that particular context. Now, the second thing that the rapid test can do is if you feel symptoms, and you want to have a rapid check of whether these symptoms are symptoms of COVID-19, and you take that rapid test immediately, and in 15 minutes you get the result. Now, if that result is negative or positive, doesn't matter. If you really feel symptoms that you may be contaminated with COVID-19, you need to take what is called a molecular or PCR test to validate that. But it gives you a quick idea of whether you should take immediate actions to isolate from others. So that's a useful tool, but not a complete tool, because you still want to be double certain by having a very precise molecular test. So these are the two main purposes for which the rapid test can be used.
Oops. Ashley Burke, CBC News.
Good morning, Minister Duclos. Same sort of question on the rapid tests. We're just hoping to find out, will the federal government continue to give rapid tests to provinces who are not distributing them widely and also freely to citizens?
Well, we've been providing these tests free, and we are continuing to do so. We are also multiplying by 5 just in December the average delivery of rapid tests over the last month. So this is, and that's great. Now we've been able to answer a relatively recent request from all provinces and territories to speed up the delivery of rapid tests. Now, so fortunately, we are able to do that, and in fact, match exactly the demand of PETs and provinces and territories for December, and we'll continue to do what we can to match further demands in the new year. This being said, how rapid tests are used in Canada in specific provinces and territories, that depends on the conditions and I would say priorities of provinces and territories. Like in Quebec just this morning, listening to the radio, in my home city of Quebec, I was hearing that they were, and that's great news, they were distributing the rapid tests in daycare centers. In Ontario, they've been distributing them in schools and universities, I understand. In Saskatchewan, they've been making them available directly, I believe, through pharmacies to the general population. So there are different models that have evolved in Canada over the last few weeks. And what I hear from my colleagues, what I heard from them on Wednesday, is that they are looking at each other and trying to see what works best. You know, they don't need to work in perfect synchronicity, but I think they're looking at each other and trying to do as well as the others are doing, taking again into account that they have different conditions, different partnerships, and different priorities.
But as you stated in your opening remarks, there have been a lot of unused tests in provinces and territories as well. What is your message to those regions who are not distributing them more widely?
My understanding is that, yes, there has been a significant amount of unused rapid tests for a relatively long period of time, but at this particular date, at this particular period in the history of COVID-19, so at this time now, the stocks in provinces and territories are relatively low, and that's why the delivery of these 35 million rapid tests is going to help.
Okay, Mike to my left.
Good morning, Tessie Sanchi with Hill Times Research. Minister Duclos, I'd like to ask you about a separate matter that affects your office, which is drug pricing regulations that are supposed to be in effect on January 1. Your government has already delayed them 3 times. Can you say today on December 10 that those drug pricing regulations will be in effect on January 1, 2022?
Well, what I can say now is that we are obviously mindful of this important issue. I've been obviously in touch with some of the important stakeholders, including provinces and territories with which we need to work, and I will hopefully have something soon to say on the matter.
So you're not committing to them being in place on January 1, 2022. What would you say to stakeholders? It's been a bit of a hamster wheel, especially the last 2 delays. Folks have been getting notice 2 or 3 days, before the rules are supposed to be in place. What would you say to stakeholders who are just frustrated, whether they're for the rules or against the rules? They're not sure up until a few days whether or not there will be different rules in place.
Well, we understand, and I certainly understand that is a very important part of our overall efforts to reduce the costs and increase the access to medicines across Canada, including obviously the more costly medicines that have tended to emerge over the last years, almost all of them patented. So it's obviously an important piece of the agenda around making medicines less costly, more accessible, and also addressing the serious long-term challenges that we face in sustaining our healthcare expenditures over the next years. But I'll have more to say, hopefully as quickly as is feasible.
Okay, Mike Lecouture, Global News.
Still introduce myself if that's okay, Elizabeth. Mike Lecouture with Global News, Minister. Good to see you. I wanted to ask you, in light of what we're seeing with Omicron, not only around the world, but here in Canada, what is your advice to Canadians who are sitting around saying, I was promised that I can travel if I get double vaccinated, and I was promised that I can gather if I get double vaccinated? What are you going to tell Canadians? What is your message to them today about holiday travel and holiday gatherings?
Maybe I should turn to Dr. Tam, or Dr. New, who always say these things with greater eloquence and sometimes greater...
I'm sure they'll get the question later.
Okay, well,
since you're here, I thought I'd ask you.
Very good. No, because I wouldn't want you to feel that I'm forgetting about Dr. Tam and Dr. New, but that you are telling me that you won't forget about them. Now, what we can tell Canadians is something that they've known since the beginning of COVID-19. COVID-19 is a virus and then a disease over which we have learned many things over the last 20 months, and that's going to be the same with the new variant. And the new variant tells us that we need to be even more vigilant when, in particular, we think about traveling outside of Canada. As we said earlier, Omicron is not yet prevalent in Canada, has limited community transmission. That is going to change. and you'll look at the modeling of Dr. Tam and Dr. New in a moment, you'll see how it could change relatively quickly. But it's not, the community transmission of Omicron now is limited, and therefore it's not, domestically speaking, what people should think about when they plan their holiday opportunities with friends and families. However, if they think about traveling outside of Canada, Omicron should be a big red part of their radar screen. It should be flashing, because things are happening very quickly outside of Canada. And so if they think of traveling, that should be a serious alarm bell, a serious concern for them, because it's not only about coming back to Canada, and when they come back to Canada, they should expect delays and hassle. That's going to be it, because we're going to do what we need to do to protect the health and safety of Canadians at airports. But they should also be mindful that it's going to be uncertain and risky to travel in a number of other countries over the next weeks, given the serious increase in the incidence of Omicron that we are seeing abroad.
I also want to follow up on the rapid tests. In one case, you had said that they've gone largely unused. You also said that you don't want to blame the provinces and territories for not using them, yet the federal government has delivered nearly $100 million to the provinces and territories. They're going largely unused. How can you not blame the provinces and territories for not using something that you have handed to them as a federal government to use more widely?
Because they, as I said earlier, they have had to focus on priorities such as, vaccination and looking after the healthcare system, and the use of the most precise testing procedure, which is the molecular test. Now, when you have significant prevalence of the virus in a particular environment, molecular tests, that's what you need to use, because you don't want to miss anyone. So molecular testing has been, until now, probably the most important type of testing that we could use, because to protect the health and safety in environments where there is a lot of COVID-19 incidents, that's what you absolutely want to focus on. But now we've been moving to a different level of community transmission for some time. Obviously, things are changing in some of the provinces right now. But with that, we are now, in most provinces and territories, better able and certainly better guided to use the rapid test in appropriate circumstances.
Okay. Mike to my left.
Laura Osmond, the Canadian Press. Thanks so much for taking our questions this morning. My question is about this testing and mandatory quarantine policy for incoming travelers. The government's social media posts have been saying you will have to quarantine, you will be tested at the airport, as if this policy is fully enforced. You're saying we're only about halfway to the capacity that we need to fully enforce that policy. It's creating a lot of confusion for people who are worried about consequences for not following the rules when they don't really know what the rules are before they get to the airport. So what certainty can you give to people? What is their experience going to be if they're traveling in the next few weeks?
Well, there is one certainty, which is that the Canadians should expect to be tested and quarantined when they enter Canada through an airport from a place other than the United States. And they should expect that because, as we said earlier, we've made, not only was that present before November 30th, now I spoke about the 3,000 daily tests that air travelers were being administered randomly, but we've moved from that relatively small base, 3,000, and we've added 6,000 more tests, and we need to add another 6,000. So 3 plus 6 plus 6, plus 6 already, and 6 coming, that's, I think, will tell Canadians that the likelihood of having to be tested and quarantined when they come back into Canada, that likelihood is increasing quickly. Now, what they should also do is always listen to the directives of border officers and PHAC officers when they enter their particular point of entry into Canada.
I also want to ask you about domestic measures. I know we're not speaking about the modeling yet, but we can imagine that the effect of Omicron on our domestic case count could be very dramatic. And so you've been speaking with your counterparts at the provinces. I'm wondering, when this becomes no longer an international issue, if the Omicron variant does take hold in Canada, as the modeling no doubt predicts it could, what kind of domestic policies are you looking at with your fellow ministers in the provinces to limit the spread here?
Until now, and Dr. Tam might step in if you want, if you allow that to happen. Until now, the public health measures that have been understood and applied for almost 20 months now remain exactly those that we need to follow with the new variants. Social distancing, personal protective equipment, washing hands, watching symptoms, being tested if we've been in contact with someone possibly infected, or if we have symptoms. So those are the fundamental public health measures that I understand need to continue as long as the variant, the virus is with us. I might turn to Dr. Tam just to say whether Dr. Tam have said something that he would have said otherwise.
Yeah, we know the public health measures that do work, and they will work against any variant. But we will go into things in a little bit more detail later.
Thank you very much. Now we're going to go to the phones. It'll be one question, one follow-up, and the shorter the questions and the shorter the answers, the more people we can get in, because Minister Duclos does have a plane to catch. We want to get as many people a chance to ask a question as possible. Operator?
Thank you. Merci. You may press star 1 if you have a question. Vous pouvez appuyer sur étoile 1 si vous avez une question. The first question is from Erica Walsh from the Globe and Mail. Please go ahead.
Good morning, Minister. Thanks for taking our questions. I just wanted to follow up on just one data point. You said today that testing capacity has increased 50%. Earlier this week, you were saying 60%. So just to clarify, so it is now 50%? And to Louis Blouin's question, when are we actually going to be fully there? You're saying these are necessary steps. So when are we actually going to have that fully in place? Will we be able to have it fully in place?
Thank you. And I understand that these percentages can be confusing. The overall, there are two pieces. The one piece is air travel. The other piece is land travel. So if we add land and air travel together, all the tests at land and at airport, as we said earlier, we need to increase that total testing capacity by 60%. Now, if we focus only on air travel, we were at 11,000 on November the 30th. We're now at 7,000, so it's an increase by about 50%. We need to go to 23,000. That's for just air travel test.
Marika, do you have a follow-up?
Yes, I do. Thank you. So going on to your comments about travel being risky and unstable, or that the situation abroad is both risky and unstable, as I think is the terms that you used. Are you planning to change the advisory that is currently in place that Canadians who are fully vaccinated can travel? You seem to be strongly warning against travel, but the official advice appears unchanged. So can you just clarify which advice Canadians should be following? Is it safe if you are fully vaccinated to travel, or will the government be changing its formal advice?
The advice that we're using is a combination of the advice of public health officials within Canada and that the advice coming from international partners, including the advice that comes from informational flows that they transfer to us, so we understand better, obviously, the situation outside of Canada when we have great collaboration with our partner countries on what they see on the ground. So it's a combination of what experts here tell us and what we hear from others outside of Canada. So it's a combination of these two, and the resulting advice to Canadians therefore changes as the situation evolves. The main advice is to be extremely prudent when it comes to thinking about traveling outside of Canada. We're not currently advising Canadians not to travel. That could come, and if it does come, it will have to come through a combination of different input, as I said, in different sorts of advice. But what we see now, what we hear now from public health officials in Canada and from the international context, is that people need to be very aware that traveling outside of Canada, as I said, comes with risk and uncertainty, and things can change quite rapidly.
Next question, operator. And if I am serious about if people can ask questions quickly, then we will be able to get more people in, because unless the minister can stay later than I've been told, we've only got 5 minutes left.
La prochaine question de Boris Proulx, Le Devoir.
Next question from Boris Proulx from Le
Monsieur
Devoir.
le ministre, 17 000 tests, il en manque 6 000 pour atteindre votre objectif. Qu'est-ce qui se passe avec ce
6,000 tests
trou de 6 000
missing.
tests? Est-ce qu'il y a des
What is going on
passagers
with
qui
that?
rentrent
Those
sans se faire
missing 6,000 tests. There are travelers coming in without getting
La première, c'est
tested.
qu'il y a effectivement
Minister Duclos, two
une
things are
capacité
happening.
incomplète jusqu'à
First of
maintenant,
all,
même si
there
elle a
has
été
been
augmentée
incomplete
significativement,
capacity
comme on l'a noté au
until
cours
now,
des
even though,
derniers
as we
jours.
said, over the
La
past
deuxième
days,
chose,
we
c'est qu'il y a
have ramped
toujours
it up significantly.
une priorisation
Secondly,
de ces
there's always
allocations de tests aux frontières
prioritization
aériennes
of
et
the
terrestres.
allocation
Donc, les
of
gens
these
qui arrivent
tests, whether it
de
be at the
l'étranger
land border or at airports.
testés d'une
People
manière
arriving from
aléatoire,
abroad
oui, mais d'une
have
manière
been tested
aléatoire
randomly.
qui tient compte
Yes.
des risques que ces gens puissent amener avec
But
eux
it has
le
also
virus ou le
been
variant.
not random, because we have paid attention to the
Merci.
risks
Est-ce que
that
vous avez une idée
these
du
people could be carrying the
pourcentage de taux
virus.
positifs qui reviennent, ou combien de gens avaient
Follow-up question. Do you
effectivement la
have an
COVID?
idea of the percentage
Ça,
of how many people
laisser
have been carrying
Dr. Tam et le Dr. New
the
vous donner
virus
ces
out of the
informations parce qu'elles
test?
changent assez rapidement
Answer.
et ce sont eux
I
qui ont
will
les
leave that to the
informations les plus
doctors because
précises.
that information changes rapidly.
Boris, est-ce que c'est possible d'avoir la réponse dans la
Boris.
deuxième partie de la conférence de presse?
Could we give you the rest of that answer
Okay,
in the
parfait.
second part of the press conference?
Operator, next question.
Yes.
The next question is from Alex Ballingal from the Toronto Star. Please go ahead.
Hi, thanks very much. I just want to clarify, Minister Duclos, you said that you expect the transmission of Omicron inside Canada will change, or the community transmission will change, if I heard correctly. Can you just clarify what you mean? Are you guys expecting that despite these border measures and the testing capacity and all the things you're doing to try and prevent more cases from entering Canada, that community transmission of this variant will increase?
Well, the answer is yes. Community transmission it will increase, and and in fact, it's an important feature of the presentation you'll hear very soon from Dr. Tam and Dr. New.
So just quickly as a follow-up then, so what is driving that? If we're focusing on the border, what do we need to do to try and prevent that increase? Are we doing enough? Why are we expecting it to increase?
Our border measures are probably the most effective of all measures around the world. You know, we can always do better, but we've done extremely well compared to many other countries. And the reason is that we have multiple layers. The first layer is the pre-arrival test. Now, every traveler entering into Canada by land or by air needs to have a pre-arrival test. Now, the government has been criticized for that for some time. No, we should not have a pre-arrival test. But that's an absolutely central feature of our border measures right now, and this was going to be maintained. The second layer is the arrival test. That has always been there, but we're in a partial randomized manner. And now what we're doing right now is to make it complete for an important portion of air traveling. Then we have quarantine obligations that we have had since the beginning of COVID-19. And these measures, not only have they been maintained in many contexts since the beginning of COVID-19, but they were absent in many other countries. And that's another reason for which we have been extremely good through limiting importations of the virus and now the variant compared to many other countries. This being said, as we mentioned earlier, these tests and these procedures are by definition imperfect. So although they delay very significantly, the importation of the virus and the variant, they are not going to stop the variant and the virus from entering into Canada. And that's why community transmission, although quite limited now, is going to be a challenge when the variant becomes more prevalent. But on that, again, it will be useful to hear and to turn to Dr. Tam and Dr. New.
We have a couple of minutes left. Operator, next question.
La prochaine question de Annie Guillemette.
Next question from Annie Guillemette.
FM. La parole est à vous.
Over to
Bonjour,
you.
Monsieur le ministre.
Thank
Vous
you.
avez parlé à
Good day,
quelques
Minister.
reprises des voyages.
A few times you mentioned travels. I'd like to hear you in French on your official recommendation. You told Louis Blouin that things are changing quickly. But where are we on the government's official recommendation? Answer.
Au Canada, pour
Well, what we're
l'instant, il y
telling
a
people
très peu de
is that in
transmission
Canada, at
du
this
variant
time,
Omicron.
there is very
À
little
l'échelle internationale,
Omicron
dans beaucoup
spread.
des pays où les gens peuvent
But
songer à aller,
abroad,
la situation
in
change
many
très
countries where
rapidement. Les gens qui se
risks are
retrouvent à
doubled.
l'étranger se retrouvent
Number
dans des
one,
circonstances très
people
difficiles,
may go
puisque
abroad
les
and
mesures
find
des autres
themselves in
pays
very
peuvent
difficult
changer
situations
très
because
rapidement.
measures
Et
in
on l'a
other
vu au début
countries
de la
can change very
COVID-19 il y
quickly.
a de cela 20 mois. Et la
And
deuxième
we
chose,
saw
c'est que
this
lorsque les
happening
gens
over the past
vont
20
revenir au
months with
pays, ils doivent
COVID-19.
s'attendre
The
à ce que
second
les
risk is when people
procédures
come back to
à la
Canada.
frontière et
They will face
post-frontière sont des
procedures
procédures qui
at the
prennent du temps,
border.
qui soient
These
compliquées,
measures
qui les
take
amènent à
time.
devoir
There
se
will
mettre en
be
quarantaine
delays.
pour
They
un certain
may
nombre de jours, qui pourrait très bien
need to
être
quarantine
plusieurs
for
jours, parce que le
a certain
système
number
va
of
être
days.
va
It
être
may be
sévère et
many
sérieux.
days
On va devoir faire
because
les choses
we may
correctement
need
pour
to
protéger
be
la santé
strict
des
and
gens.
severe in order to protect
Se soucier
Canadians'
de
health.
ce double risque,
So
celui
people
d'aller
must
à
be aware of
l'étranger,
that double risk
en fonction des endroits où les gens veulent aller, et celui de revenir au pays
when
et
they are
d'avoir
abroad
à vivre
and
des
when they come
désagréments
back
et
to
des délais
Canada,
qui
which again
vont déranger.
is a time when they may face delays
Je comprends
because of
donc qu'il n'y a pas de
procedures.
recommandation de ne pas
Follow-up.
voyager à l'heure actuelle.
So there is
Ma
no
question
recommendation not to
suivie serait
travel
sur les tests
currently.
rapides, les livraisons.
Second
Est-ce
question,
que encore
on
là, on
the
doit
delivery
se fier aux
of
compagnies,
rapid
aux
tests,
fabricants parce qu'on n'a pas
should we trust
d'avance
manufacturers and companies if we,
concernant les demandes qui ont été faites par les provinces?
because
Les
provinces and
demandes
territories,
les livraisons vont
regarding
très
provinces
bien.
and territories,
Alors déjà,
shipment
je parlais à
dates.
mon collègue, le ministre
Answer.
Dubé, plus
The
spécifiquement
situation
pour
is
le
going
Québec.
very
Donc la
well.
demande
I
de
spoke
10
with
millions de
Mr.
tests
Dubé
rapides
in Quebec.
que le gouvernement du Québec a fait, elle est
The province of
reçue, puis
Quebec
elle va être
has
respectée d'ici
requested
la
the number of
période des
tests it
fêtes. Donc, le
needs,
10 millions
and
de
those
tests que le
tests,
Québec a demandé. D'ailleurs, les tests
10
dont on entend parler
million, to be exact,
du
will be
gouvernement du
delivered
Québec
in
au cours
time
des
for the
derniers jours,
holidays.
entre autres ceux qui vont être livrés dans les services de garde, ce sont des tests
Some will
rapides qui
be
viennent
sent
du gouvernement
childcare
canadien qui ont été livrés dans
services.
les derniers jours, que le gouvernement
Those
du
come
Québec
from the
va
government of
utiliser,
Canada,
entre autres, dans
and
les
the
services
government
de
of
garde
Québec
pour les
will
enfants, les
use them,
jeunes
including in
enfants et les
those
jeunes familles,
childcare
et les
centers
autres
for
tests
young
qui vont être
children and
livrés
young
là, au cours
families,
des prochains
and
jours
other tests
pour
will
atteindre
be
le seuil et
delivered
la
over
demande
the
de 10
coming
millions de
days
dollars. Ben, ce
in
sont des
order
tests
to
que le gouvernement
attain
du Québec
that
va utiliser
requested number
comme
of
il le voudra bien.
10,000
Et c'est la même
tests
chose pour les
to be
autres
delivered
provinces
to
et les autres
Quebec.
territoires.
And
Et
it
je
is the
rappelle encore
same
que
for other provinces and territories.
ces 35 millions de tests qu'on est en train de livrer, c'est 5 fois
Remember, those 35
la livraison
million
moyenne des
tests
derniers mois. Donc,
that we have
on travaille
promised
ensemble
to
très bien.
deliver is
D'ailleurs,
5 times the
je
tests that
félicite
went
et remercie
unused.
tous mes
We're
collègues des
working
provinces
very
et des
well
territoires de
together,
l'avoir
and I
fait au cours des
congratulate
dernières
all of
semaines.
my
En travaillant ensemble
counterparts
très bien,
in
on est
the
capable
provinces and
d'augmenter
territories
extrêmement
because over the past weeks we
de manière
have
très
done
importante
great work and
la
have
quantité de tests qui
succeeded
vont être disponibles
in
pour les familles
significantly increasing
et
the
les
number
gens
of
au
tests
Québec
that
et
will
ailleurs.
be available for families
Merci,
and people in
Minister
Quebec and
Duclos.
elsewhere. Thank you, Minister
The
Duclos.
minister has to bid adieu to us because he has his plane. So hold on, and we will be turning to Doctors Tam and New. Yes.
Okay, hello everyone. Bonjour à toutes et à tous.
Good day, everyone.
Today we'll provide a latest update on the national epidemiology and modeling work that informs the ongoing management of COVID-19 in Canada. As we head into the holiday season, we are faced with some new challenges, both in terms of renewed epidemic growth of the Delta-driven wave in Canada and the emergence and rapid spread of the Omicron variant of concern globally. At the same time, we've made important advancements by increasing our protection with vaccines and strengthening the measures we have available to reduce spread. Although uncertainties remain regarding the potential impact of Omicron, we know that maintaining these measures continues to be essential to the pandemic response in Canada, heeding public health advice, completing our primary series of COVID-19 vaccines, getting a booster shot when eligible, and keeping up with the basic personal precautions like wearing a well-fitted, well-constructed face mask, avoid crowding, improve ventilation, and other layers of protection continue to be our best and safest way forward.
Bonjour à toutes et à tous.
Good day, everyone.
Aujourd'hui, nous ferons le point sur les
Today,
travaux
we'll provide the
d'épidémiologie
latest
et des
update
modélisations
on the
effectuées
national
au pays
epidemiology
qui
and
orientent la
modeling
gestion
work
continue de
that
la
informs the
COVID-19 au
ongoing
Canada.
management of the
À l'approche de la
COVID-19
saison des
situation
fêtes,
in
nous
Canada.
faisons face à de
As
nouveaux
we head
défis,
into the
à
holiday
savoir
season,
une
we are
nouvelle
faced with
croissance
some
de la
new
vague
challenges,
provoquée par le variant
both
Delta au
in terms
Canada,
of renewed
ainsi que
epidemic
l'émergence
growth
et la propagation
and of the
rapide
Delta
du
driven
variant
wave in
préoccupant
Canada and
Omicron
the
dans le monde.
emergence and rapid spread
Cela
of the
dit, nous avons
Omicron variant
réalisé
of
des progrès
concern
importants
globally.
en augmentant
We
la
have made
protection
important
conférée
advances
par les
by
vaccins
increasing our
et en
protection
renforçant
with
les mesures à
vaccines
notre
and
disposition
strengthening
pour
the
réduire la
measures we have
propagation.
available to reduce spread.
Bien que des questions demeurent quant à l'impact possible du
Although
variant Omicron, nous
uncertainties
savons que le maintien
remain
de ces mesures
regarding the
reste
potential
essentiel
impact of
pour la lutte
Omicron,
contre la
we
pandémie
know
au
that
Canada.
maintaining these measures
Le respect des
continues to be
conseils de santé
essential to the
publique,
pandemic response in
l'obtention de la
Canada.
série primaire du vaccin
Heeding
contre le
public health
COVID-19,
advice,
obtenir une
completing
dose de
our
rappel
primary
pour les
series
personnes
of COVID-19
admissibles et le
vaccines,
maintien
getting a
des
booster
mesures de
dose when
précaution
eligible, and
personnelles
keeping
de
up with
base,
basic
comme
personal
porter un masque
precautions
bien
like
conçu
wearing a
et bien
well-fitted,
ajusté, éviter
well-constructed
les
face
foules,
mask,
améliorer la
avoiding crowding,
ventilation et
and improving
adopter d'autres
ventilation
moyens de
and other
protection
layers of protection
continue d'être la
continue to
façon la
be
plus
our
efficace
best and
et la plus
safest
sûre d'aller
way
de l'avant.
forward.
On slide 1, since the last epidemiology and modeling update in November, the trend in average daily case counts has shifted from a decline to a gradual but steady increase. Over the past week, there were an average of over 3,300 new cases being reported daily across Canada. With daily new cases increasing, there is concern that national severity trends could begin to rise again. On average, in the past week, over 1,460 people with COVID-19 were being treated in our hospitals each day, including over 450 in intensive care units, and 20 deaths were reported daily. As we head into the winter months with a strained health system in many areas of the country, a high degree of caution is needed to minimize spread and impact, particularly during the upcoming holiday season.
Diapositive 2.
Slide
La situation vécue
2.
dans les 6 provinces les plus populeuses illustre les
These 6
variations
most populous
constantes
provinces
quant à l'activité
illustrate
de
some
la
of the
maladie
ongoing
pendant la
variation
4e vague
in disease
au
activity
Canada.
experienced
Bien que
during
l'activité
Canada's
de la
ongoing
maladie
fourth
ait
wave.
diminué dans de nombreuses
While
régions
disease activity
durement
has
touchées par la
declined
4e
in many
vague,
areas
les
that have been
données
hard
tardives
hit
sur les
during the fourth wave,
hospitalisations, les
lagging
admissions aux soins
hospitalization and
intensifs
critical care numbers
continuent
remain
d'indiquer
elevated
que le nombre
and
de
the
cas
health
est
system
élevé et que le système de
is
santé
heavily
est poussé
strained.
à sa limite. Ne sont pas
Not
représentées d'autres
shown
régions du
are
pays
other
où la
areas of the
propagation de la
country
maladie a été
where
mieux
disease
maîtrisée
spread
au
was
cours
well
des précédentes
contained
vagues de la
during
pandémie,
previous
mais
waves
où
of the
des
pandemic,
introductions répétées du
but
variant
where
Delta
repeated
qui se
introductions
propage
of the
rapidement
rapidly
ont
spreading
entraîné des
Delta
éclosions
variant
ainsi
has
qu'une
resulted
transmission
in outbreaks
communautaire qui
and
demeure
community
difficile
spread
à
that
contrôler.
continue to be challenging to control.
Slide 3, our RT, the reproduction number, has been relatively unstable due to considerable regional variations in disease activity and day-to-day reporting fluctuations. However, nationally, the RT has remained above 1 for over 5 weeks, indicating that the epidemic is in a growth pattern.
Diapositive 4.
Slide
Au cours
4.
des 3e et 4e vagues
Over the
de la
course of the
pandémie, le
third
taux
and fourth
d'incidence
waves of
a
the
augmenté
pandemic,
chez les enfants
incidence
de moins de
rates
12
have
ans,
been
dont
increasing
la
among children
majorité
under
n'était pas
12 years of
admissible à la
age.
vaccination
Many
contre
of
la
whom
COVID-19
were not
avant
eligible for
l'autorisation
COVID-19
récente d'un
vaccination
vaccin pour la
rather
tranche d'âge
until the
de 5
recent
à 11 ans.
approval of a
Les programmes de
COVID-19 vaccine
vaccination
for
des
5
enfants
to
constituent
11-year-olds.
un nouveau moyen de
Rollout of
protection
pediatric
important qui
vaccination
permettra
programs
de réduire les taux
provides an
d'infection
important additional
élevés dans
protection
cette tranche d'âge.
option to
En plus de
reduce
conférer une
high
protection
infection rates
directe
in
aux
this
jeunes
age
enfants
group. In
contre
addition
les
to
maladies
providing direct
symptomatiques
protection
et
against
potentiellement graves,
symptomatic or
la
potentially
vaccination
severe
peut
illness,
aider à réduire la
vaccination of young
propagation de
children can
coronavirus
help
dans les
reduce
écoles
spread
et d'autres
into
milieux.
schools and beyond.
Maintenant que 95% de la
Now that
population est
95% of
admissible
the
à la
population
vaccination,
is
il y
eligible
a
for
d'autres
vaccination,
avantages
there
indirects
are
à continuer
additional
d'accroître la
indirect
couverture
benefits
vaccinale
of
dans la
further
population,
increasing
à
total
savoir la
population
réduction du
coverage.
fardeau du
These
système de
include
santé
easing
et la
strain
réduction de la
across the health
propagation
system
au sein des
and
familles
limiting
et
spread
des
within
collectivités
families
pour
and
mieux
communities
protéger
to
les
better
enfants de moins
protect
de 5
children
ans
under
qui sont
5
trop
years of
jeunes pour
age
être
who are
vaccinés.
too young to
En
be
particulier,
vaccinated.
il
In
continue d'être
particular, it
important pour
continues
les
to be
parents et le
important for
contexte proche
parents
des enfants de
and
moins de 5
eligible
ans
close
de
contacts of
recevoir une
children
série
under 5
complète de
years of
vaccins
age to get
ainsi
fully
qu'une dose de
vaccinated
rappel telle que
and receive
recommandée
a
qui
booster dose as
contribuera
recommended,
davantage
which can
à leur
contribute to
protection.
their protection.
Slide 5. This graph of cases associated with school and childcare outbreaks in Ontario and Quebec represents about half of the Canadian population, shows 5 to 11-year-olds remain the most prominent age group in these settings. However, encouragingly, several key features of the outbreaks involving children indicate sensitive monitoring and a positive impact of vaccination and infection prevention control measures that are being employed to keep these settings safer, while striving to keep them open for the benefit of children. Ongoing monitoring during the fourth wave indicates most school and childcare outbreaks involving youth have been small, with fewer than 5 cases. Compared to the third wave, there were fewer school outbreaks associated cases occurring in the 12 to 17-year age group, which are increasingly well vaccinated. Outbreak activity in schools mirrors community trends, and vaccination of household members can help prevent spread to young children and subsequent introduction into schools. COVID-19 cases among children most often do not involve severe illness. To date, there have been over 380,000 reported cases in children and youth up to 19 years of age, with less than 1% involving severe illness.
Diapositive 6.
Slide 6.
Malgré que la circulation généralisée du
While
variant Delta,
widespread
hautement
circulation
contagieux,
of the
reste la
highly
principale
contagious Delta
préoccupation au
variant
Canada et dans de
continues to
nombreux
be the
pays,
dominant concern in
l'émergence de la
Canada and
propagation
many countries
récente du
worldwide,
variant préoccupant
recent
Omicron
emergence
nous
and spread
rappelle à
of the
quel point
Omicron
les choses
variant of
peuvent
concern
changer
is
rapidement
a
dans
reminder
le
how
contexte de la
quickly things can
pandémie.
shift in
En
this pandemic.
collaboration avec les autorités sanitaires
Together
et
with
des
health
experts du monde
authorities
entier,
and
nous
experts
surveillons de près les
worldwide,
caractéristiques
we
clés
are
du
closely
variant
monitoring key
Omicron, y
characteristics
compris sa
of the Omicron
transmissibilité,
variant,
sa gravité
including
et son impact
transmissibility,
sur l'immunité.
severity, and
À date,
impact on
il semble que le
immunity.
variant Omicron ait le
To
potentiel de se
date,
propager
it appears
beaucoup plus
the Omicron
rapidement que
variant
le
has the
hautement
potential to
transmissible
spread
variant
much faster
Delta.
than the
À ce
highly
point, on ne
transmissible
sait pas s'il
Delta
existe un
variant.
risque plus élevé
At
ou
this
plus
time, it
faible
is not
de maladies
known whether
graves
there is a
et de
higher
décès
or
avec ce
lower
nouveau
risk of
variant,
severe
mais il
illness
est possible
and
qu'un
death
plus
with this
grand
new
nombre
variant,
total de
but it
cas
is
ait
possible
un
that a
impact sur la
larger overall number of
capacité
cases
du système de
could
santé.
impact
De même,
healthcare capacity.
l'efficacité du vaccin est sous
Likewise,
évaluation.
vaccine
Le variant
effectiveness is
Omicron
under
pourrait diminuer la
investigation.
protection vaccinale
The Omicron
contre
variant
l'infection,
may
mais un
decrease
certain
vaccine
niveau de
protection
protection
against
contre la
infection,
maladie grave
but
est
some level of
susceptible de
protection
rester.
against severe
De plus,
disease is
le
likely to
variant
remain.
Omicron pourrait échapper à
As well, the
l'immunité
Omicron
acquise par
variant
une
may be
infection
able to escape
antécédente.
immunity
Peu
from
importe le
prior
variant en
infection.
circulation, la
Regardless of
vaccination
the variant
combinée aux
circulating,
mesures de santé publique
vaccination
et aux
in
précautions
combination with timed
individuelles
and targeted
continue
public
d'être
health measures
important
and
pour
individual
ralentir les
protective
taux
practices
d'infection de la
continue to be
COVID-19
important for
et aide
slowing
à réduire
COVID-19
l'impact sur
infection
les
rates
systèmes de
and
santé.
help reduce the impact of healthcare capacity.
Slide 7. The Delta variant continues to circulate widely and is still associated with the vast majority of new infections reported in Canada. However, incidence varies considerably across health regions. Health regions that have achieved high vaccination coverage while maintaining public health measures continue to be in a stronger position for this winter respiratory season. And with the recent emergence and spread of the Omicron variant, including detections in most jurisdictions across Canada, we need to maintain a high degree of caution everywhere. As of December the 9th, there have been 87 confirmed cases of Omicron reported in 7 jurisdictions. Although most of the initial cases were detected in recent international travelers or their close contacts, cases with no known links to travel have been reported more recently, which may be indicative of community transmission. Fortunately, to date, all reported cases of Omicron in Canada have been asymptomatic or mild. Public health authorities and laboratories continue to closely monitor for additional cases in Canada and to assess symptoms and potential severity.
Diapositive 8. La
Slide
récente
8.
approbation de vaccins à usage
Recent
pédiatrique
approval of
contre la
pediatric
COVID-19 pour les
COVID-19
enfants de 5
vaccines
à 11 ans au
for
Canada
5 to
signifie
11-year-olds
que
in Canada
95%
means
de la
that
population canadienne
95%
totale
of the
est
total
désormais
Canadian
admissible
population
à la
is now
vaccination.
eligible for
Étant donné
vaccination.
que certains enfants de 11 ans dont le 12e anniversaire
Since
est
some
en 2021
11-year-olds
ont
with a
reçu le
12th
vaccin de
birthday
manière
in
non conforme à
2021
l'étiquette dans le
received
cadre du
off-label
programme
vaccinations
pour
as
les
part of
12
the
à 17
12
ans,
to
le groupe
17-year-old
âgé de 5 à
program,
11 ans a déjà
the
atteint
5 to 11-year-old
17% de
age
couverture
group
vaccinale,
has
dont
already
moins une dose,
achieved
et 1%
17%
d'entre eux
coverage
sont
with at least one
entièrement
dose,
vaccinés.
and 1% are
Dans
fully
l'ensemble,
vaccinated.
plus de 62,5
Overall,
millions de
more
doses de
than
vaccins contre la
62.5
COVID-19 ont
million
été
doses of
administrés au
COVID-19
Canada
vaccines
depuis le début de
have
la
been administered
vaccination à la
across Canada
mi-décembre
since
2020.
vaccination
Plus de
began in
81% de
mid-December
la population
2020,
totale a reçu
providing
au moins
over
une dose de
81%
vaccin
of the
contre la
total
COVID-19
population
et plus de
with at least
75
one dose
à
of the
16%,
COVID-19 vaccine,
76% des
and
Canadiens
over
sont entièrement
76%
vaccinés.
of
Et
Canadians are
plus,
fully
au-delà de 2
vaccinated.
millions de troisième doses de
As
vaccins
well,
contre la
over 2
COVID-19
million
ont été
COVID-19 vaccine
administrés.
third
De même,
doses
la
have been
couverture
given,
vaccinale a continué
which
à
includes booster
augmenter
doses.
dans tous les groupes d'âge,
Likewise, vaccine
atteignant
coverage has
plus de
continued to
88
increase
à
across all age groups,
95%
reaching
couverture vaccinale
over
complète
88 to
parmi les adultes de 50 ans
95%
et
fully
plus
vaccinated
et de
coverage in adults aged 50 years or
82
older,
à 86%
and 82
couverture
to
vaccinale complète
86%
parmi les
fully
jeunes et les
vaccinated
adultes
coverage
de 12 à
in youth
49 ans.
and adults aged
Cependant,
12 to
si l'on tient
49
compte des
years.
enfants de 5 à
However,
11 ans,
with the
plus de
inclusion
7
of
millions
5 to
de Canadiens sont
11-year-olds,
admissibles
there
à
are
la
currently
vaccination,
over
mais
7
ne sont
million
pas
Canadians
encore
who are
entièrement
eligible
vaccinés
but
contre la
not yet fully
COVID-19.
vaccinated
Il est
against
donc important que
COVID-19,
nous
so it's
poursuivons nos
important we
efforts pour
continue efforts
augmenter
to
la couverture
increase
vaccinale
vaccine
afin de
coverage
protéger
to
autant de
protect
personnes que
everyone we
possible.
can.
Slide 9. Being fully vaccinated continues to provide substantial protection from severe illness, in particular younger people who are at lower overall risk of severe illness due to COVID-19 and develop stronger, longer lasting immunity from vaccines than older adults have a substantially lower risk of hospitalization if they are fully vaccinated compared to being unvaccinated. Among youth and adults aged 12 to 59 years, unvaccinated people were 32 times more likely to be hospitalized with COVID-19 than fully vaccinated people. And even though older adults have relatively higher overall risk of developing severe illness and may have less robust response to vaccinations, being fully vaccinated still provides a clear and significant protection advantage against severe illness compared to not being vaccinated. Among adults aged 60 years or older, unvaccinated people were 16 times more likely to be hospitalized with COVID-19 than fully vaccinated people. As health authorities across Canada continues to monitor vaccine safety and effectiveness data, advice and programs are being regularly updated to ensure Canadians are provided and can maintain the best possible protection against COVID-19.
Diapositive 10. Cette
Slide
mise à jour
10.
des prévisions à plus long terme montre
This
comment la
updated
trajectoire
longer-range
épidémique pourrait
forecast
évoluer
shows how
jusqu'à
the
la
epidemic
mi-janvier,
trajectory
y
could
compris la
evolve through
trajectoire
mid-January,
potentielle avec
including
et sans
potential trajectories with
remplacement de
and
Delta par
without
Omicron.
Delta
Si nous
replacement by
continuons sur la
Omicron.
voie que nous suivons
If we
actuellement
continue
avec
along the
nos
path
niveaux
we
de
are on now,
transmission actuels
with our
et sans que
current
le
levels
variant
of
Omicron
transmission,
remplace le
but
Delta,
without
nous pourrions
Omicron
nous attendre
replacing
à voir
Delta,
une
we could
résurgence des cas
expect to
le long
see
de
a
la
resurgence
trajectoire
in
de la
cases
ligne
along
gris
the dark
foncé.
gray line
Si Omicron
trajectory.
ne prédomine pas sur Delta,
If
nous
Omicron
pourrions
does
mieux
not
contrôler
predominate over
l'épidémie
Delta,
le long de la
we could bring
trajectoire
the
de la
epidemic
ligne
under better
violette
control
en
along the purple
diminuant
line
de 15%
trajectory
la transmission
by
à
decreasing
l'échelle de la
community-wide
communauté.
transmission by
Alternativement, même
15%.
si Delta continue de prédominer,
Alternatively,
une
even if Delta
augmentation de
continues to
15% de la
predominate,
transmission
a
pourrait
15%
entraîner une
increase in
résurgence
transmission
rapide des cas
could
le
result
long
in
de la
rapid
trajectoire de
resurgence
la
of
ligne
cases
bleue.
along the blue
Cependant, si on
line
suppose que le
trajectory.
variant Omicron est 3 fois
However,
plus
if we
transmissible que
assume
le
the
variant
Omicron
Delta
variant
et
is
qu'il
3
devienne
times
prédominant
more
au Canada,
transmissible
il est
than
possible que nous
Delta
ayons une
and becomes the
résurgence de
dominant
cas
variant in
le long de la
Canada,
trajectoire
it
de
is
la ligne
possible
orange
that we could
qui
have a
s'accélère
resurgence in
rapidement.
cases along the
Bien qu'il
rapidly
existe
accelerating
encore une
orange
incertitude
line trajectory.
considérable concernant le
While
potentiel
there is
d'Omicron
still
à
a
échapper
considerable
à l'immunité et
uncertainty
à
regarding the
augmenter la gravité,
potential for
une
Omicron to
résurgence
evade
rapide des cas
immunity
pourrait
and increase
potentiellement
severity,
mettre à rude épreuve
rapid resurgence
notre
in
système de
cases
santé
could
bien
potentially
fragile.
strain our still fragile
Bien que
healthcare
cette
system.
provision soit préoccupante,
Although this
il nous est
forecast
rappelé
is
que les
concerning,
modèles
we are
ne montrent que
reminded
les
that models
possibilités
show only
futures
future
et qu'avec une action
possibilities,
rapide et
and that
appropriée,
with
nous
fast and
pouvons
appropriate
éviter une
action, we
trajectoire
can
selon
avoid a
le
worst-case
scénario du
scenario
pire cas
trajectory,
possible,
as we
comme nous
have
l'avons
done
fait dans le
in the
passé.
past.
La vitesse de transmission d'Omicron et
The
le
speed
potentiel
of
pour une
Omicron
forte
transmission
résurgence
and
signifie
potential
que
for
nous
strong
devons aborder
resurgence
les semaines à venir
means we
avec
must
beaucoup de
approach the coming
prudence
weeks
et en
with
même
an
temps
abundance of
être prêt
caution,
à agir
and
rapidement
at the
pour
same time,
contrôler
we
la
must be
propagation
prepared to
au
act
premier
quickly
signe
to
d'une
control the spread
accélération
at the
rapide
first
des cas.
sign of rapidly
Je veux aussi
accelerating
attirer votre
cases.
attention à
I
la
would also like
diapositive
to
17 qui
call your
démontre
attention
qu'une
to slide
résurgence est
17,
actuellement
which shows
prévue
that a
pour l'Ontario
resurgence
et le
is
Québec.
expected
Si le
for
variant
Ontario and
Omicron
Quebec
remplace
currently.
Delta,
If
la
Omicron
résurgence
replaces
serait possible
Delta,
dans d'autres
the
régions.
resurgence will also be seen in other areas.
Thank you. Just to repeat what Dr. News just said, there is a slide 17 in your package that shows some of the regional forecasts indicating that resurgence is forecasted in a number of regions if Omicron replaces Delta. So these scenarios on slide 11, these scenarios do not include the potential impacts of the Omicron. But aims to illustrate what could happen through 2022, taking into account the possibility of waning protection of vaccines. It is important to note that this model assumes a very significant waning of protection in order to better illustrate the potential impact of different vaccination strategies. The scenario on the left illustrates an extreme example to show what could happen if there was no vaccination of 5 to 11-year-olds and no boosters given to adults. In this scenario, the model shows there is a high risk of having a resurgence with the potential to exceed hospital capacity in 2022. In the middle scenario, which includes vaccinating 5 to 11-year-olds, but with still no boosters given to adults, the simulated scenario is improved, but resurgence could still occur. Lastly, in the scenario on the right, the combined effect of vaccinating 5 to 11-year-olds and giving booster doses to adults 18 years of age or older could significantly reduce the risk of resurgence in 2022 under the assumptions in the model. This scenario could therefore reduce the risk of exceeding hospital capacity in the months ahead. While these are just theoretical scenarios, this modeling highlights the importance of expanding and strengthening our vaccination programs to reduce the risk of strong resurgence.
Diapositive 12.
Slide
Les expériences au sein d'autres pays continuent de
Experience
renforcer le
of
besoin
other
pour une
countries
couverture très
continues
élevée
to
de la
reinforce the need
vaccination
for
avec
very high
l'application
vaccine
soutenue
coverage
des mesures de santé
together
publique
with
et
sustained
individuelles
public health
afin
and
d'éviter
individual
une
measures
résurgence rapide
to avoid a
prédominée par le
rapid
variant Delta,
resurgence where
ainsi
Delta
que
is
de retarder
predominating, as
l'accélération
well
et
as
le
to delay
remplacement par le
acceleration and
variant
replacement
Omicron
by
à
the even
propagation
more
encore
rapidly
plus
spreading
rapide.
Omicron
Comme pour
variant.
d'autres pays d'Europe,
As
la
with other countries
trajectoire
in
de
Europe,
l'Allemagne illustre
Germany's
qu'en dépit des
trajectory
succès
illustrates
antérieurs
that
à
despite
maîtriser
previous
l'accélération de
success
l'épidémie,
in controlling
l'assouplissement des
epidemic
mesures de santé
acceleration,
publique en
easing
l'absence
of
d'une
public
couverture
health
vaccinale
measures in
très
the
élevée
absence of very
peut
high
entraîner
vaccine
une forte
coverage
résurgence
can
d'une
lead
vague
to a
Delta,
strong
mettant à
resurgence
rude
of a
épreuve la
Delta-driven
capacité
wave,
des soins de
placing a
santé.
heavy strain on
Alors que le
healthcare
variant
capacity.
Omicron commence à se propager là
As
où le
the
variant
Omicron
Delta est
variant
encore
begins to
prédominant,
spread
des pays
where the
comme le
Delta variant
Royaume-Uni
is still
illustrent la
predominating,
vitesse à laquelle
countries
Omicron
like the
peut
United
s'installer
Kingdom
des premières
illustrate the speed with
détections à
which Omicron
l'expansion
can
rapide
take
de la
hold
propagation
from first detections
communautaire.
to rapid expansion of community spread. This cautions us of the high likelihood of Omicron replacing the Delta variant in a very short period of time. This is clearly illustrated by the near vertical spike in cases seen in South Africa as Omicron rapidly accelerated and replaced the Delta variant. Globally, the Omicron variant is spreading further and quickly. Community transmission is now being reported in many parts of the world, including many areas of the United States. In light of this, Canadians are urged to carefully consider the increased risks and high potential for disruptions associated with international travel over the holidays.
Slide 13. Despite the challenges ahead with the continuing Delta-driven wave in Canada and emergence of the Omicron variant, we have more and better protections going into this holiday and winter season than previously. This time last year, we were experiencing double the number of daily cases and more than double the number of people with COVID-19 being treated in hospitals and in intensive care daily. Most importantly, daily reported deaths are 82% lower than this time last year. Vaccines have given us substantial protection from infection and severe outcomes to date, dampening the impact of the Delta-driven wave this fall, which could have been many times more severe or required more stringent restrictions had it not been for the added protection of vaccines. Vaccines and our expanding coverage continue to give us an advantage over this virus. And while some reduction in protection is possible with the Omicron variant, COVID-19 vaccines are still expected to provide a level of protection, particularly against severe outcomes. As well, experts and health authorities continue to update our vaccination program advice, and we can better ensure that Canada's vaccines and vaccination programs continue to provide Canadians with the best possible protection. So, as we look to the holidays and weeks ahead, caution is still warranted. But as you consider the risk for you and yours, we can be thankful we're better protected with vaccines and have more choices to allow us to come together more safely. We're safer when everyone who is eligible is fully vaccinated, and if all who are eligible also get a COVID-19 booster dose. And regardless of our vaccination status, we can stay safer over the holidays by keeping up with the latest public health advice, taking precautions when in indoor spaces with others outside our immediate household, and using layers of protection to reduce risks, including wearing a well-constructed and well-fitted face mask, keeping gathering sizes smaller, and improving ventilation, maintaining our good habits with hand and cough hygiene, staying home and away from others if we're experiencing any symptoms, and getting a COVID test, especially if symptomatic or as recommended. The speed of Omicron transmission and potential for strong resurgence means we must approach the holidays and weeks beyond with an abundance of caution, while being prepared and following the advice of health authorities who will need to act quickly to control spread at the first sign of rapidly accelerating cases. Thank you. Merci, Miigwech.
Et finalement, pour terminer, la diapositive 13.
And
Malgré les
finally,
défis à
slide
venir avec
13.
la vague continue entraînée par le
Despite
variant
the
Delta au
challenges
Canada
ahead
et
with the
l'émergence du
continuing
variant
Delta-driven
Omicron,
wave in
nous
Canada
avons des
and the
protections plus
emergence of the
nombreuses et
Omicron
plus
variant,
efficaces pour cette
we
saison
have
des
more and better
vacances et
protections
de
going
l'hiver
into this holiday and
qu'auparavant.
winter season than
À la même
previously.
époque, l'année dernière, nous
This
connaissons
time
le
last
double de
year,
nombre de cas
we were
quotidiens et
experiencing
plus de
double
double de
the number
nombre de
of
personnes
daily
atteintes de
cases
COVID-19
and more
étaient
than
traitées
double the number
quotidiennement
of people
dans les
with
hôpitaux et les
COVID-19
soins
being treated
intensifs.
in hospitals
Plus
and
important
intensive
encore, les
care
décès
daily.
signalés quotidiennement sont
More importantly,
82%
daily
moins
reported
élevés
deaths
qu'à la
are
même période l'an
82%
dernier.
lower than this
Les
time
vaccins
last
nous
year.
ont offert une protection
Vaccines
considérable
have given us
contre l'infection
substantial
et les
protection
conséquences
from
graves
infection
et
and from
atténuant
severe
l'impact de la
outcomes
vague
to date,
provoquée par
dampening
Delta
the
cet
impact
automne,
of the
qui aurait pu
Delta-driven
être
wave this
beaucoup plus
fall,
grave
which
ou
could have
nécessiter
been
des
many
restrictions
times more
plus strictes
severe or
sans
could
la
have
protection
required more
supplémentaire
stringent
des vaccins.
restrictions had it
Les
not been
vaccins
for
et
the added
l'expansion de
protection of
notre couverture
vaccines.
vaccinale continuent
Vaccines
de nous
and our
donner un
expanding
avantage
coverage
envers ce
continue to give
virus.
us an
Et bien
advantage over
qu'une
this
certaine
virus.
réduction de la protection
And while
soit
some
possible
reduction
en
in
vue du
protection
variant
is
Omicron,
possible
les
with
vaccins
the
contre la
Omicron
COVID-19
variant,
devraient toujours
COVID-19
fournir un
vaccines
niveau
are
de
still
protection, en
expected to
particulier
provide a
contre
level
les
of protection,
conséquences graves.
particularly
De plus,
against
alors que
severe
les experts
outcomes.
et les autorités sanitaires continuent de
As
mettre à
well,
jour
as
nos pensées
experts
sur
and
les
health
programmes de
authorities continue
vaccination,
to update
nous
our
pouvons être
vaccination
mieux
program
assurés
advice,
que les
we
vaccins
can
et les
better
programmes de
ensure that
vaccination au
Canada's
Canada
vaccines and
continuent de
vaccination
fournir aux
programs
Canadiens
continue
la
to
meilleure
provide
protection
Canadians
possible.
with the best
Donc,
possible
alors que nous
protection.
nous tournons vers le temps des fêtes
So,
et les
as we
semaines à
look to the
venir, la
holidays and
prudence
the
est
weeks
toujours
ahead,
de mise. Mais
caution
si
is
vous
still
considérez les risques
warranted.
pour vous et les
But as you
vôtres,
consider the risks
nous
for you
pouvons
and
être
yours, we
reconnaissants
can be
d'être
thankful
mieux
we are better
protégés par les
protected
vaccins
with
et d'avoir
vaccines,
plus de choix
and we
pour nous
have more
permettre
choices to allow us
de
to
se
come
rassembler
together
en
more
sécurité.
safely.
Nous sommes plus en sécurité lorsque toutes
We are
les personnes
safer when
éligibles sont
everyone who is
entièrement
eligible
vaccinées et
is
si
fully
toutes les personnes
vaccinated,
admissibles
and
reçoivent
if all who
également
are
une dose de
eligible
rappel
also
contre
get
la
a
COVID-19.
COVID-19 booster
Et,
dose.
quel que soit notre
And
statut vaccinal,
regardless
nous
of
pouvons
our
rester
vaccination
plus en
status,
sécurité
we can
pendant le
stay
temps des
safer
fêtes
over the
en
holidays
suivant les derniers
by
conseils de
keeping up
santé
with the
publique,
latest
en
public health
prenant des
advice,
précautions lorsque
by
nous nous
taking precautions
trouvons dans les
when we
espaces
are in
intérieurs
indoor
avec les
spaces
personnes
with others
en
outside
dehors
of
de
our
notre
immediate
foyer
household,
immédiat et en utilisant des
and
niveaux de
using
protection
layers of
pour réduire
protection
les risques.
to reduce risks.
Porter un masque
Layers of
facial
protection
bien
include
construit et bien
wearing a
ajusté,
well-constructed
garder
and
nos
well-fitted
rassemblements
face
plus
mask,
petits et
keeping
améliorer la
gathering sizes
ventilation,
smaller and
maintenir
improving
nos bonnes
ventilation,
habitudes d'hygiène des mains et de
maintaining
la
our
toux,
good habits
rester à
with
la
hand
maison et
and
loin
cough
des autres
hygiene,
si nous
staying
éprouvons des
home and
symptômes
away from
et se
others
faire
if we
tester
are
pour la
experiencing any
COVID-19,
symptoms,
particulièrement
and
si vous
getting a
avez des symptômes
COVID-19 test,
tels que recommandés.
especially if
La vitesse de
symptomatic
transmission
or
du
as
variant
recommended.
Omicron et
The
le
speed of
potentiel
Omicron
d'une forte
transmission
résurgence
and potential for
signifie que nous
strong
devons aborder
resurgence
le temps des
means
fêtes
we
et les
must
semaines
approach the
au-delà
holidays
avec beaucoup de
and the weeks
prudence,
beyond that
tout en
with an
étant
abundance
préparés
of
et en
caution,
suivant les
while
conseils
being
des
prepared and
autorités
following the
sanitaires
advice
qui
of health
devront agir
authorities,
rapidement pour
because
contrôler
they
la
will need to act
propagation
quickly
au
to
premier
control
signe de
spread
cas
at the
qui
first
s'accélère
sign of
rapidement.
rapidly accelerating
Merci.
cases.
Thank you.
Thank you.
Miigwech.
Merci, miigwech.
Thank you. It's time for questions. We will start with questions in the room. Those who want to ask a question, go to the mic, and then we will go to questions on the phone. It's one question, one follow-up. First question to Mike LeCouture, Global.
Doctors, thank you for taking the time to take our questions. In light of the modeling you've just presented and the warning of prudence, there are a number of Canadians who have followed a lot of these briefings and who have done everything you've said, got double vaxxed, and with the promise of, if you get double vaxxed, you'll be able to do more things. And we know things have changed. But what is your message to Canadians who have this feeling of invincibility because they did get double vaxxed and feel like, I should be able to gather, I should be able to travel? With everything that you're presenting right now, what is your clear message to them about making decisions in the next 2 weeks to either have a gathering at home or travel?
This is Teresa Tam. Maybe I'll start. So getting the vaccine is still the most important layer of protection, and people should still get it if you haven't, and get a booster shot, particularly people over the age of 50. And that is still key advice. Because what we are seeing is that vaccines are still very good at very, very good at protecting you against severe outcomes. So that's really important to do. In terms of the time period ahead and going into the holiday period, it is actually, of course, really difficult for people to think, well, we've done all these things. We're really looking forward to a giant party. And now you're telling us that there's another variant. I've been saying that the winter period is going to be a bumpy road towards a brighter spring, if you like. So this is another bump on the road, and we still don't know enough about the Omicron variant, except that it looks like it's very transmissible. So I think that keeping private gatherings small is actually quite important at this point while we learn more. I think that you can still have a really good time by linking with family or your immediate friends, and so that you can do this safer. Gathering with smaller number of people in well-ventilated places, all of those layers of protection we just talked about can still enable you to have a good time while being safer and being precautionary. Of course, gathering with vaccinated people is still going to be safer than gathering with unvaccinated people. But if you've seen some of the news about this Omicron variant is that vaccinated people could still get infected. So you just need to be mindful of that. In terms of travel, I think that traveling within Canada at this point in time means that you're likely to have a much better experience than if you're heading into the international destinations. So I think if you haven't actually booked any of these trips, staying closer to home, I think is definitely the better choice. And if you have already booked your trips, as the minister said, things can change very rapidly in the international context. Right now, and every hour, there's a different number. But what I do know is 61 countries, as of last night at least, have already confirmed that they have the Omicron variant, and some of them haven't detected widespread community transmission. But still, because of that uncertainty, people need to take it into account, not just because of your risk of getting infected, but the risk of all the different rules that might be fluctuating in the international context.
Thank you for that. Dr. New. I just to underline that the main points that Dr. Tam has already put forward. If you look at this sort of holiday season compared to last holiday season, I think it really, I think it's a bit different, obviously, because we have the vaccines and they're a great tool. So I think to underline the point again, try to ensure as much as possible that if you have any family gatherings, that everyone's vaccinated, and if obviously if you're eligible, get that sort of a booster dose. So that's number one. And of course, now the kids 5 to 11 are also eligible to get a vaccine. So that's great. But all the other proven public health measures that we've been repeating so often about, face masks and so on, I think we need to double down on that. I think people, you're right, maybe have been reassured because of the vaccines and how well they've worked that, okay, maybe I don't need my face mask. But, there's emerging evidence that, with the new variants, they're so much more transmissible, and even people are fully vaccinated can still, get infected and pass it on. So if you have a family gathering, as Dr. Tam said, maybe try and keep it small. Maybe there's a good discussion to be had about people, even fully vaccinated, still wearing their face masks indoors, obviously well-fitted, well-made, and so on. And then the other part about ventilation, we talked about it, previously, but it's maybe something to consider this holiday season. I know it's the winter, but maybe, having a window open maybe for a certain amount of time, on the hour, et cetera, just can help, the circulation of the, the virus sort of dissipate. So those are sort of practical things you can do. And then, of course, all the other things about good hand hygiene, of course, don't even think of hopefully, getting together with people if you're sick and staying home. I think all that applies. For international travel, it's the same thing. Take a serious look at, your sort of your vaccine status. If you are maybe in a certain age group that has underlying, health issues, other conditions that put you at higher risk of severe consequences, I think you should really think twice, even if you're fully vaccinated. Then, of course, as Dr. Tam said, looking around the world, it's the pandemic's raging in many countries around the world that haven't been so fortunate as ourselves in terms of their vaccine coverage and sort of the use of public health measures. And so it really, I think, behooves you to take a careful look. What is the vaccine coverage? What is the epidemiology if you're still planning to go overseas and take a careful look? And as we all know, the situation can change rapidly. If, let's say, there's widespread community transmission suddenly occurring in a country that you might be wanting to go to, then the local authorities might put in measures that maybe aren't in place now. And of course, coming back to Canada, certainly we're trying to do what we can to slow the spread of the vaccine in Canada with what we're doing at our border with testing and quarantine. So those are all the things to think about, and hopefully Canadians can take that to heart and plan accordingly. Thank you.
Thank you for those fulsome answers. I just wanted to sort of pick up on the sentiment out there in Canadians and how, despite being fully vaccinated now, where you guys are looking at Omicron right now and the potential of having to bring back in or at least suggest lockdowns or different other restrictions, how worried are you about how those could be received when you consider the fatigue that is being experienced by Canadians who feel invincible being fully vaxxed, because that's exactly what you said Canadians should do? And how are you weighing that as you look at the curves and how you're trying to stop Omicron from taking hold here in Canada?
It's Teresa Tam. I'll take that. So I think people should take heart in that, as you've seen, even if you go back to one of the first slides, slide 2 or something like that, on the different curves, what is most striking is the reduction in deaths and some of the severe outcomes. So I think people should bear that in mind. This is a gift that we did not have last year. And I think focusing on and how much that has given us, it is tough. And this virus keeps dealing us the next card in the deck. And sometimes, it is difficult to imagine, but we can get through this. I am still optimistic. This is another bump. I think we should, I certainly feel better about not getting severe outcomes from definitely the Delta virus. We still have to learn more about the Omicron virus in terms of severity. But I think why we're asking for caution is that when that curve takes off, and it can take off very rapidly, as you've seen in the United Kingdom, even lower severity impacts can result in a large number of people ending up in the hospital. So we just want to keep things smoothed out and manageable. And so I think we're asking for everyone to collaborate so that you don't have to close schools and do all those things. This year is very different. Look at this fall compared to last. We've had the ability to ensure people are back in those essential work, school, and economic spaces. Let's try and keep it that way.
Bonjour, une question pour le Dr New. Première question en 2 volets. J'aimerais savoir, à vos yeux, selon vos estimations, quelles sont les probabilités que le variant Omicron devienne dominant au Canada? Parce qu'on a l'impression, à vous écouter, que c'est un peu inévitable. Et j'aimerais savoir à quoi ressemblerait la vie si le variant Omicron devenait dominant. Est-ce qu'il faudrait s'attendre à plus de restrictions? À quoi ressembleraient les mesures sanitaires qu'il faudrait prendre?
Taken afterwards.
Merci pour la question. Oui, c'est une bonne
New,
question. Et
thank you for the question.
À l'heure actuelle, on continue avec nos homologues à travers le monde à ramasser les données probantes pour répondre aux
data with our
questions
partners around the world to answer 3 important questions regarding the variant of concern.
Aussi gravité de la maladie, aussi l'efficacité des vaccins.
Severity of disease, and the efficacy of vaccines against it.
Transmissible, même comparé à
we are seeing that it is even more spreadable than the Delta variant. But for the other 2 points, we still do not know. We will have to follow them closely, looking at the situation here in Canada and around the world.
C'est possible que le variant Omicron peut être le variant prédominant dans peut-être quelques semaines. On voit qu'est-ce qui se passe actuellement le Royaume-Uni, aussi en Allemagne, les autres pays. Donc, c'est quelque chose qu'on peut imaginer. C'est possible ici au Canada. C'est pourquoi nous continuons avec nos meilleurs efforts.
The same thing could be possible in Canada. That is why we must continue with our measures at the border and also must continue working together with other countries to take the best measures to reduce the spread as much as possible.
Les cas signalés à date ici au Canada, que les cas
here in Canada, to date,
asymptomatiques ou même avec les symptômes légers.
Donc, ça,
c'est des bonnes nouvelles, mais il ne faut pas être trop optimiste. Il faut toujours être prudent et continuer à utiliser toutes les mesures de santé publique et aussi l'adoption des vaccins pour ralentir la propagation. Mais c'est juste possible, on ne peut pas dire non.
But it is always possible. Things we are seeing abroad could happen in Canada. We cannot say that the Omicron will not become the predominant variant. We must continue with vaccines and public health measures.
Vous dites qu'on assiste à une resurgence en Ontario, au Québec, 2 provinces qui ont augmenté le nombre de personnes autorisées pour un rassemblement de Noël. Est-ce que c'est une approche qui est souhaitable quand vous voyez cette resurgence-là, d'après vous? Et vous avez parlé de réduire la taille des rassemblements de Noël. Alors pour vous, c'est quoi
speaking about decreasing gathering size. So what are your what is your advice? What would be reasonable?
On a toujours comme un avis personnel. Ce que je peux vous dire, c'est que
well, we always have our personal
de
opinions,
l'Ontario
but
et
here's
du
what I
Québec,
can tell you. In the provinces of Ontario and Quebec,
bonne communication et étroite collaboration avec nos homologues et c'est sûr que les autorités de santé publique dans les deux provinces, en effet, à travers le pays, suivent étroitement la situation épidémiologique dans leur propre comité de juridiction. Et c'est sûr qu'ils sont prêts à changer, adopter, peut-être modifier les mesures de santé publique. Concernant les rassemblements,
measures can be adapted.
Je ne sais pas, peut-être c'est même quelque chose que les provinces peuvent peut-être ajuster dans les jours, semaines à venir. Mais pour moi, personnellement, je pense que
ce n'est
pas une bonne idée d'avoir peut-être un rassemblement de 25 personnes, 20 personnes, peut-être quelque chose de plus intime.
Smaller gatherings
would
be advisable. I don't think it's advisable to gather in groups of 20 or 25. What do I mean by a smaller group? Well, perhaps more like a gathering of 10 people. This must be decided while considering the regional epidemiological situation. So in one city or town, it's very important to follow local public health measures. I have my own opinions, which I will apply to gatherings within my family, but I will also follow advice from local health authorities. Thank you.
Thank you. Kristen Agakute, sorry for that, CTV.
Thanks, doctors, for taking our questions. On slide 11, it shows that if vaccinations are offered for kids 5 to 11 and boosters are offered to 18 plus, cases will not exceed hospital capacity. Why is NACI not giving a strong recommendation that all 18 plus be eligible for boosters right now?
I think NACI has recommended that boosters be offered to 18 plus, but the focus, and if your objective is to reduce serious outcomes, the key focus still remains the older age groups and the other higher risk populations. So I think for systematic rollout, but also because there's a recommendation at this point to maximize the immune response and using a interval of 6 months or more, which means that if you do a systematic rollout from when you had your last dose, it actually just works out logistically and programmatic planning perspective that the younger age groups will come a bit later. So I know that all province territories are focused on getting the older age groups and the higher risk groups vaccinated right now. That's just the priority. But I think all of them are committed to essentially moving towards everybody getting their booster. Of course, with the Omicron variant, we are still awaiting some of the further information on its impact on vaccines.
And my second question, Dr. Tam, you mentioned there is now community spread of the Omicron variant, so travel restrictions will likely not be enough to stop this spread. Will you recommend that provinces start putting in place more restrictions and gatherings to stop this community spread?
We have reports, and they're not many. There's the odd reports of people with Omicron who cannot be linked to a travel-related case. So that is a first sign of community spread. We haven't seen major spread, or at least we haven't had it reported to date. So it depends on where you are, as it has been throughout the pandemic. The epidemiology can be quite different in different provinces, territories. So the local epidemiology absolutely will drive the response. And if you're seeing a rapid increase in cases, or there's a cluster of Omicron, then, as previously, my suggestion is act fast so that you can come out of it quicker. by acting fast now and making sure people are observing all these layers of protection and keep your gathering sizes small, while we're still learning about this Omicron variant, is the most prudent thing to do. But it depends on where you are in the country.
Thank you. Ashley Burke, CBC.
Hi, Dr. Tam. What's it like for you to hear that there are claims that staff are neglecting those staying at designated quarantine facilities, complaints about a lack of food, lack of answers about what's going on, lack of medical help? Is that acceptable to you?
I think one must strive to be as as effective as possible, as supportive as possible for people who have to undertake quarantine, which is a difficult thing to do. So while I'm not directly involved in the operational aspects of the quarantine service, I do think that any of these incidences must be reported so that they can be prevented going forward. So, I think everything has to be done to support those who are in quarantine.
And do you believe that in light of what you presented today, that boosters need to happen immediately, not 6 months after you get a vaccine?
Well, I think we're still learning about the impact of the Omicron virus on vaccines. It's possible that, and quite likely that when you get a booster, your antibody levels, for example, one part of your immune response could get boosted. And there's some very early laboratory studies, including from manufacturers, that certainly suggest that a booster dose can increase that response. But some of the studies doesn't really indicate what happens to the rest of your immune system, and the vaccine effectiveness has not been determined. I think that, of course, we can shift recommendations, but right now, we know based on vaccinology and decades of knowledge on vaccines that if you want the best or optimize your schedule, then the intervals matter. So NACI's recommendation for that interval could then increase the quality and the duration of your immune response. So I think, of course, we will be meeting, NACI can examine the issue further, and the provinces will too, once we get a bit more information from, mainly from the international experience. And there's a large amount of studies being undertaken in laboratories, in animal studies, and I hope from Europe on the real life experience of the vaccines. The other thing that I'm trying to keep in mind is that this is not the only variant that is necessarily going to come along. So we can't just keep thinking of 2 weeks ahead. We have to think about the slightly longer term, not just Christmas, but towards March break. So how do we ensure that we give the best advice on the vaccine so that the durability of that response is as good as we get. So I think the concern is that if we boosted, which I think can increase your vaccine, can increase your neutralizing antibody levels, for example, that might not last for very long. And so all of these things are being weighed. But all I can say is go get your booster when it's your turn, and please do that, and particularly those at high risk.
Thank you. Laura Osmond, Canadian Press.
Hi, Dr. Tam. You touched on this a little bit already, but on slide 10, rather, the possibilities you outlined there are quite intimidating. I'm wondering if you can speak a little bit about what you would project in terms of severe outcomes as those projections go way up. If Omicron were to take hold in Canada, what would you expect to see in terms of hospitalizations based on what we know right now?
Thank you. So what we don't know is the severity of illness from this particular variant. And we do not know the impact of vaccine effectiveness against severe outcomes. The earlier, very preliminary information coming out of South Africa and right now is that they've encountered more milder illness. And certainly the travelers that we've had coming into Canada with Omicron have had mild or asymptomatic illness. But we must not take that for granted right now. We need to wait and see because of the delay in seeing the severe outcomes from the initially infected cases. So that model doesn't model the severity. But even if the proportion of those who get Omicron, who get severely ill is tiny, if you get enough cases, you'll still have enough severe outcomes to impact your hospitals and your ICUs. So I think that is the message. And so for now, while we're still learning about this virus, being precautionary will help protect your health system.
I think people just want to know exactly how concerned they should be, given that they're vaccinated, they're protected, they're following the basic public health rules. Omicron is like a big boogeyman at this point. Given what we know about the safety that we do have, how concerned are you for people's individual safety?
Well, I think we must stay informed and vigilant, but we shouldn't panic. We know many of the layers of protection that work for any variant. If it's a more transmissible variant, you do have to be more careful when you are putting on a mask. Make sure it fits. Get the best quality mask you can get your hands on. Improve on ventilation. So when there's a more transmissible virus, we've just got to pay even more meticulous attention to the things that we know already works. I think that's the key. We will learn more, and we will let you know, I think, as soon as possible when we do learn more about the impact of vaccines. But Delta is still 90-something% of our cases, and we know vaccines work for that variant. And so I think we stay on course for now, and we will obviously inform everyone when there's more information. I still think people should take heart in having personal agency. We know how to assess our own risk. We know how to assess the risk of a particular contact or gathering, and use all of that knowledge to our advantage, and just keep the transmission low so that it's not going vertical. When we keep it low, we can then learn more in the next weeks to come, and then we can take the next steps. But still, I think people should feel optimistic about the longer term outlook.
It's Dr. New. Maybe I can just add to what Dr. Tam has said, and I think to your question, I think if I were to characterize, I think we should all, including myself, respect the virus. It's a formidable foe, and it's obviously evolving as we fight against it. And so we just need to, I think, respect it, but not to panic and be scared. We have a great number of tools now, and we know much more about the virus. So with vaccines as a great tool to help protect against serious illness, and then also with all of the proven measures, the face masks and so on, because we know about much more about how the virus is transmitted and so on. I think we just need to be respectful and cautious, but like I say, not to be I say in sort of the panic mode, which I get the sense from your question, maybe some people are worried about. So hopefully that helps answer and hopefully give a level of assurance to the general population that, hey, we've dealt with this before when we first face this virus, and we can do it again with all of the tools that are at our disposal. Thank you.
Thank you. Time to go to the phones for questions. It will be one question, one follow-up, and operator, if it's possible, to give precedence or preference to the members of the Parliamentary Press Gallery. Operator, first question.
Certainly. The next question is from Jimmy Murasha from Global News. Please go ahead.
You guys actually answered all my questions, so you can skip me.
That was fast. Operator, next question.
Thank you, merci. The next question is from Catherine Lévesque from la Presse canadienne. La parole est à vous.
Oui, bonjour à vous tous. Je voulais en
Good day,
fait poser une
everyone.
première question qui avait été posée à M.
Actually,
Duclos
my first
et
question
on n'a
was
pas eu de
asked
réponse.
to Minister
Donc, je voulais savoir,
Duclos, and
selon
we did
l'Agence
not
de la
receive
santé
an answer.
publique, là, pour ce qui est des tests
According to
de
the Public
dépistage
Health
aux
Agency of
aéroports
Canada, when it comes to
pour tous les
testing at
voyageurs, à
airports
l'exception
for
de ceux
all
en
travelers,
provenance des
except for those
États-Unis,
travelers coming from the
à
United
quel moment est-ce qu'on va
States,
avoir l'assurance que tous les
when
voyageurs
will
vont
we
être
be assured
testés? Est-ce
that
que vous
all
avez
travelers will have been
une
tested?
estimation? Est-ce que
Do you have
c'est
an
une question de
estimate?
jours?
Is it a
Qu'est-ce que
matter
vous
of
pouvez nous dire
days?
là-dessus?
What can you tell us on that?
C'est Dr. New. Merci pour la question. Peut-être je peux commencer, peut-être aussi Dr. Tam peut ajouter. Comme Dr. Tam, je pense que déjà constaté, nous deux, nous ne sommes pas, comme elle dit, vraiment à l'échelle des aspects opérationnels. Je pense que ce que je peux vous dire maintenant, c'est comme on sait c'est quoi l'objectif, le but avec les dépistages, toutes les mesures en vigueur à nos frontières. C'est vraiment, je pense que moi, j'ai dit ça avant avec un autre point de presse que c'est vraiment pour gagner du temps, pour ralentir peut-être la propagation du virus comme le variant Omicron, pour gagner du temps, pour peut-être mieux comprendre, pour avoir le temps ici au Canada, mais aussi partout dans le monde pour ramasser, analyser les données probantes concernant les trois grandes questions, la transmissibilité, gravité des maladies, aussi l'efficacité des vaccins. Et donc, toutes les mesures comme une date ou combien de dépistages, c'est important, mais je pense que la plus grande question, c'est quoi les implications et l'impact. On voit maintenant actuellement, on a déjà des cas signalés au Canada, donc c'est très important aussi. Même au sein du pays, qu'est-ce qu'on fait pour contrôler, pour faire un bon suivi des contacts, pour aussi mieux comprendre quoi les implications pour peut-être la transmission communautaire à l'échelle locale. Donc, je pense qu'on continue avec nos efforts. Comme le ministre a constaté, on continue à augmenter la capacité de dépister à la frontière, mais c'est fait partie d'un ensemble de mesures, je pense, de santé, de mesures de santé publique à la frontière, mais aussi au sein du Canada pour
at the border, but also within Canada
to
face this variant.
Merci beaucoup. Et je
Thank you very much.
Sur les rassemblements de
Follow-up
Noël.
question. I'd like to come back to Christmas gatherings. You were talking to my colleague about this, and you said that it isn't a good idea to have 20 or 25 people gathering because cases are increasing in Quebec and in Ontario, and it is exactly in those two provinces that we've been given permission to gather in groups of 20 or 25 around the holidays. Do you think those provinces should move backwards again, go back on their decisions before the holidays? Thank you for the question. As I said, I have my own personal opinion. I'm ready to make my own plans for a smaller, more intimate family gathering in my own place. Also, it is always very important to follow local public health advice. So even in the case of Ontario and Quebec, I think those provinces may still adjust their advice province-wide. But there's also flexibility in what local advice might be. I think everyone needs to remain flexible and aware that rapid changes to measures can happen. Everyone should keep apprised of local health advice. Thank you.
Operator, next question. Prochaine question.
Thank you. Merci. La prochaine question de Olivier Ferron-Boissé de TVA.
Next question is from TVA, Olivier Ferron-Boissé.
J'aimerais revenir sur
Good day. I would like to come back to the graph
la capacité hospitalière.
Regarding hospital capacity.
On a une troisième dose aux 18 ans et plus,
So,
et aux 5 à 11
if we're
ans, on
18
comprend
years
qu'on a
of
la
age or older and we have a third dose, or if everyone 5 to 11 years of age gets vaccinated, we've seen what the result would be. Can you tell us about shots for people 50 years of age and older? Here in Quebec, the booster will be given to people 60 years of age and older in January only. Do you think we should be moving more quickly? Answer. Thank you for the question. There are many questions, but we do not have all the answers regarding the Omicron variant. We don't know about the efficacy of the vaccine. But we still know that vaccines are the best tool that we can use. So we will continue to work to improve vaccine coverage, now including children between 5 and 11 years of age, and also increasing coverage, including vaccines for vulnerable people, including seniors and including
C'est difficile
immunocompromised individuals.
Maintenant, avec les données probantes on a devant nous actuellement. Mais
it's difficult to answer certain lingering questions just based on the data we have available to us at this time.
Continuer à être prudent parce que
But
comme on a déjà
I will say
constaté,
that we must continue
si
to be prudent.
le variant Omicron devient
If the Omicron
le
variant
variant
becomes
prédominant,
the predominant
même
variant,
si en général les conséquences
and
ne sont pas
even
graves pour une
if
très grande
the
partie de la
consequences
population
or the
atteinte
symptoms
avec une
are
infection,
generally not severe
avec peut-être même
for
un faible pourcentage avec les conséquences graves.
majority
Si le
of
nombre
the population
actuel
that
est
is
plus grand
affected,
et continue d'augmenter,
if
c'est
the
toujours
rate
possible d'avoir
does
un risque
continue to
accru
increase
pour
of cases in
avoir
general,
des
then
conséquences pour
that
nos
will
systèmes de soins de
still
santé.
likely
C'est
lead
pourquoi
to an impact on
on dit
our
que c'est très important
healthcare
d'augmenter la
system.
couverture vaccinale le plus haut
This is
possible
why
avec les
we
enfants
are
aussi.
focused
Les
on
populations
increasing
prioritaires. Je
vaccine
pense que
coverage,
chaque
especially
province
for
continue avec
priority
leurs meilleurs efforts
eligible
d'offrir
individuals.
les vaccins, aussi des doses de rappel. Et je
I
pense
think
que
it's important for
on va voir au
provinces
fur et à
to
mesure
offer
qu'est-ce qui se
booster
passe
shots,
actuellement avec
and it's
la
also important for us
propagation
to
du
keep an
variant
eye on
Omicron,
what's
mais aussi
happening with
comme on
the
a
spread
déjà
of
constaté
Omicron.
à plusieurs reprises, le variant Delta, parce que ça reste encore le variant prédominant au
But the
Canada.
Delta variant is still the predominant variant in Canada.
Merci. Justement, sur
question.
Omicron, je comprends que
Thank
s'il
you.
devient
Regarding
prédominant
Omicron, I
au
understand
Canada,
that if it were to
dans
become
certaines
the
provinces, on
predominant
va
variant
remarquer
in
une hausse
Canada,
accrue des cas.
we will see
ça va augmenter parce qu'il n'y a pas
a
nécessairement en ce moment
spike in
de progression
cases.
du Delta. Mais au Québec, en Ontario, c'est
In
moins
Quebec and in
clair.
Ontario,
J'ai de la misère à interpréter la courbe. Quel genre de situation on aurait
I'm having
de
difficulty
différence
interpreting
si
the
ça devient
curve of the
prédominant
trajectory.
Omicron par rapport à Delta? Est-ce que ça va être réellement
Can
des
you
hausses de
compare
cas
Omicron and
beaucoup plus
Delta for
prononcées
me?
comme on voit dans les autres provinces ou ça
Will we
devrait rester
see
similaire à ce qu'on projette pour Delta?
the same thing if
Merci pour la
Omicron
question.
becomes the
Moi, je
predominant
suis
variant
un
as we've seen
expert,
for
je ne suis pas un
Delta?
expert de modélisation.
Answer.
Oui, il y a
Thank you for the
toutes sortes
question.
des
I
questions
am not
qui
an expert
nos
in
experts
modeling,
continuent à
but we have a
examiner.
number of
Donc,
experts who
ça
continue
dépend, c'est
to
quoi, comme
monitor
dit,
the situation closely.
la tendance pour la propagation
They
du
attempt to
variant
determine
Omicron dans les
what the
deux plus grandes provinces.
estimated
C'est quoi les
trajectories could be
implications
for
si
the
on continue
Omicron
avec
variant in
le
the future?
taux de contact dans la population
And
comparé si on
they
reste,
change
si on
out
augmente à
variants, for
15%, si on
example,
diminue à
rates of
15%.
contact within the
Difficile
community.
et c'est pourquoi on continue de travailler
And it is
étroitement avec nos
difficult
homologues des provinces et
to
territoires pour
create these
vraiment,
estimates. That is why we are working closely with our
viser sur
provincial and
les cas
territorial
signalés des cas
partners
Omicron pour
to
faire
report
un bon suivi des
cases of the
contacts,
Omicron variant, to
faire
ensure
nos meilleurs efforts
effective
pour
contact
contrôler la
tracing,
propagation
and
du
to
variant Omicron, mais
roll out our
ça dépend.
best
Ça
efforts
dépend.
to slow the
C'est
spread.
quoi le résultat des efforts? C'est toujours possible que malgré
It
nos
is
meilleurs
always
efforts, que
possible that
on
despite our
peut
best
ralentir la
efforts,
propagation, mais
we might be able
on ne
to
sait pas, peut-être
slow
dans
the
quelques
spread,
semaines ou mois,
but
on
we
peut
still
avoir
do not
une
know
situation
in the
complètement
coming
différente.
weeks
Donc,
or
je
months,
pense qu'il
the
faut toujours
situation that we
continuer
will end
avec
up seeing could turn out to
l'adoption des
be
vaccins,
entirely
augmenter la
different.
couverture
So we need
vaccinale et
to
aussi
up
continuer avec
vaccine
nos mesures de
rates
santé publique.
and
Je ne
also
sais pas, Dr. Tam, peut-être quelque chose
not back
aussi
down
non,
with our
ajouter.
public
OK,
health
c'est bon.
measures. Does Dr. Tam have anything to
On répète
add?
toujours les mêmes
No?
choses parce que
Okay,
c'est
thank
toujours
you.
les mêmes,
We always repeat the same things, I know,
mesures de
but
santé publique
it's
éprouvées
because
et aussi on
these
sait
public health measures are
c'est quoi
tried and
vraiment
true.
les
They're
avantages des
proven to be
vaccins et
effective.
c'est pour pousser
And
tout le monde,
the efficacy and
plus
the
les personnes,
advantages of
peut-être les
vaccines
personnes
are very
qui
clear.
n'ont pas encore reçu même une dose de vaccin, de peut-être
Some
c'est le
Canadians
temps
still
aussi
have not
maintenant
received
de
even one dose of
se
vaccine, and
faire
I would say to
vacciner
them,
avec une dose,
now might be
deuxième dose
time
aussi
to
une dose de
receive
rappel comme
a shot of the
en
vaccine,
état
maybe a second
admissible.
shot, or a
Merci.
third shot as soon as we're all
Thank you. Operator, next
eligible.
question. Prochaine question.
Unfortunately, we don't have time for more questions.
Is there anyone left in the queue?
We have more questions.
No questions? Okay. Then this.
We do have more questions. I'm sorry, we're instructed not to take more questions, but we do have more questions.
How many people are still in the queue?
3.
Dr. New and Dr. Tam, are you able to take those 3 questions?
Yes, I'm okay with that. Thank you.
Okay.
Yes.
Operator, next question then, please. And if the questions can be quick and the answers can be quick, then we will not strain people's time.
Thank you. The next question is from Alex Ballingal from the Toronto Star. Please go ahead.
Hey, thanks very much for the going into overtime here. I really appreciate it, you guys. Just on sorry, I think it was slide 17, where it shows the provinces. So the gray line, current levels of transmission, like it looks like Ontario and Quebec are already on pace for this. Quite a resurgence, as you say, that looks even consistent with the Omicron replacement. So am I reading that right, that these 2 provinces are on pace already, given what's going on now, for this strong resurgence? And if so, does that mean that stronger health measures are needed in these 2 provinces to get off this resurgent trajectory?
Yes, Teresa Tam. So if you also refer back to some of the slides at the beginning, it shows that Canada's case rates are going up, mainly driven by the 2 largest provinces, and that those are cases. And so I think the provinces are also looking at hospitalizations and the other impacts. And if you unpack the numbers even more, right now, those cases are in the youngest age groups, schools, and daycare, which we subsequently demonstrated. So I think, they've been looking at all of these parameters together, not just the case rates, in deciding what kind of public health measures are reasonable in their context. But I'm just urging extreme vigilance and caution, because the Omicron variant could take over pretty fast, and we don't know what the impact is on the severity indicators or on hospital capacities, and that might be different in different jurisdictions. So what you see, the projections there are for cases, but there are other considerations as people take into account their policies. But any escalation in cases could result in more hospitalizations.
And just quickly as a follow-up, I know you guys have been asked this a couple times, I think in French. Sorry, it's a blurring in my mind here, but you say small gatherings over the holidays. People should go small. I heard reference to 20, 25 people. Is it kind of a region-specific thing in terms of a cutoff, or what would you guys say, just to be super clear to Canadians who are planning dinner parties and stuff over the next few weeks? What does small gathering mean?
Yeah, so you're right in that we always stress that you should look at the local epidemiology. So if you're doing your personal assessment of what you should do at Christmas, first of all, make sure you know what's happening in your community and know that that could change. So have other plans. If you had one plan, you should maybe have other plans like Plan B, because by Christmas, things could look quite different, but plan for different eventualities. Right now, with the Omicron variant and some of the knowledge we still have to gain, to be prudent is good to keep, I think, gathering small. And by that, we're not prescriptive. We just said, let's think about families and your close friends where you know the vaccination status. That is the safest thing to do. But it does depend, as you've seen, it's very different in terms of disease activity in different areas of the country. But I just think that given the Omicron variant, if we can all do our part in reducing the risks of transmission for now, while we're learning things, that will be our collective effort to minimize our risks. I think provinces will have different policies, but I think we can all think of our particular situation, do our best in minimizing these risks. There have been super spreading events with the Omicron variant from other countries. So, and those were different kinds of gatherings, not your family ones, but they're more, but some of them have been potentially, social gatherings. Others are conferences or events like that. So I think anything to avoid a super spreading event is prudent at this point.
Thank you very much. Operator, next question. Prochaine question.
Merci. The next question. La prochaine question est d'Annie Guillemette, Cogeco Nouvelle 98.5
Question from Annie Guillemette. Over to you.
Merci. Bonjour, ma première question a déjà été répondue. C'est très clair concernant les rassemblements. Qu'en est-il des voyages pendant les fêtes? Est-ce que vous recommandez aux gens justement de rester à la maison et d'annuler ou de ne pas réserver de voyage à moyen terme justement en raison de la capacité de transmission là, qui semble élevée à la
high transmissibility rate of the new variant?
Merci pour la question. C'est Dr. New. Ce que je peux vous dire, c'est très important de voir, de faire ce que je peux dire comme une auto-évaluation, parce que c'est un peu personnel avec même comme un seuil de tolérance des risques, mais on sait que si on est une personne peut-être plus âgée avec les conditions sous-jacentes, je recommande peut-être fortement, peut-être c'est pas une bonne idée de voyager à l'étranger. On sait que la situation au Canada, c'est pas mal comparé à beaucoup des autres pays parce qu'on a une bonne couverture vaccinale.
Is good compared to that in other countries because we have good vaccine coverage and most Canadians follow public health measures.
Continue à travers le monde et
But we see that the pandemic is continuing
c'est différent d'un pays à l'autre. C'est pourquoi c'est très important. Si on considère de voyager à l'étranger, premièrement, pour moi, c'est numéro un, il faut être entièrement vacciné. Ça, c'est numéro un. Considère aussi les autres conditions personnelles de risque comme les conditions sous-jacentes.
Underlying conditions or other factors applicable to that individual.
Être conscient que la situation épidémiologique peut changer dans n'importe quel pays et aussi les mesures de santé publique en vigueur peuvent changer aussi dans chaque pays. Donc, c'est très important d'être toujours au courant avec les mesures, les exigences dans les autres pays. C'est peut-être une bonne idée de regarder quoi la couverture vaccinale dans les autres pays. C'est quoi l'application des mesures de santé publique? C'est aussi c'est quoi peut-être vos plans potentiels pour les activités? Est-ce que vous allez faire des activités peut-être un peu comme isolées des autres, comme la randonnée, ou est-ce que c'est vraiment rentrer dans une situation de rassemblement avec beaucoup de personnes? C'est fait partie de toutes les considérations et finalement aussi, c'est sûr que si on retourne au Canada, on continue avec
Turning back to Canada,
avec des mesures à nos frontières. Donc, il faut aussi attendre
with measures at our borders.
Les attentes pour les dépistages, la quarantaine, des autres mesures ici, même à
testing,
notre frontière ici au Canada pour les voyageurs qui rentrent au Canada.
Donc,
toutes les considérations, c'est pas pour moi pour dire à n'importe qui voyage ou voyage pas, mais il faut être vraiment conscient avec toutes les considérations, tous les risques, même ici au Canada et même aussi à l'étranger.
Of all the risks here in Canada and abroad. Thank you.
Merci. Operator, last question.
Thank you. Merci. The next question is from Christine Barak from CBC National News. Please go ahead.
Thanks, doctors, for taking our questions. Just quickly, we know that some Canadians are really scrambling to buy rapid tests right now. Do you have any advice on using them? And Dr. New, you mentioned you're having a small gathering. Would you ask people to take a rapid test before they attend or not?
It's Dr. New. I guess maybe I should start. If there was a question for myself, I'm sure Dr. Tam has lots to say. Not to get into all specifics, we always talk about using the right test in the right place at the right time. And so not to get into all of the details between what we call rapid antigen tests, which have a certain characteristics in terms of what I might call sensitivity, specificity, and then, of course, the molecular tests, which we know also have certain attributes which make it, I would say, maybe at the end of the day, more precise in being able to give a diagnosis. And so for rapid antigen tests, I would say that there are some key considerations because of the, I would say, the drop-off or the fact that they don't work, I would say, as well as a molecular test, that they need to be used in the very specific situations. I think the minister already mentioned that in certain contexts, if you're doing a sort of regular testing, let's say in certain workplaces, maybe in schools or whatever, there might be a possibility of that being useful. I would say also that, if you're trying to rapidly deal with outbreaks, if you have the beginnings of an outbreak in terms of maybe rapidly identifying what the spread might be in certain situations, then yes, the use of rapid antigen tests. For me, in terms of my personal situation, I think, whether they might have any utility, first of all, I can tell you right now, I fully expect that all of the guests at my family get together are fully vaccinated. And certainly also clear instructions for myself included. We might cancel it because I'm the host. And if anyone's coming down with symptoms or feeling ill, you shouldn't be coming. So that I think is number one. And we certainly know that the rapid tests have a certain use. If you are ill, then it's maybe a quick way to determine whether you might have COVID-19. Obviously, maybe to be then confirmed by a molecular test. So to me, I guess quite honest, I don't anticipate using them in my personal context, because it's really, if you get the greatest yield in terms of determining, if you have COVID-19, if you're symptomatic, my first stance is that if you're symptomatic, you have any signs of illness, no, you shouldn't be coming to my family get together. So hopefully that answers part of your question, but I'll turn it over to Dr. Tam for anything else she would like to add. Thanks.
Mm-hmm. I would just say that, if you use a rapid test, it should be an additional layer and not let go of some of the other layers of protection that we've been talking about, and know the limits of the rapid tests. And so that's I think before anyone uses a rapid test, just learn about it and learn what it can or cannot do. And that if you tested yourself today, there are false negatives, but you take that into account. As I said, if it's just part of one layer of protection, that's one way of thinking about it. From a sort of national perspective, this is not a limitless resource either. So I think if you're looking at public health program perspectives, as Dr. New said, there are other considerations, and making sure that we target these tests in the best way possible. For personal use, just make sure you know that these tests are not perfect. And if you think you need to get another test after the serial testing can reduce false positives as well. So you should take into account your personal context and what kind of gathering you're having, who's there, etc. But it shouldn't be seen as a substitute for the other layers. Thanks.
Yeah, it's Dr. You just to add to what Dr. Tam said. I think it's another layer of protection. So it's a bit of a shout out to, I guess, the family members are coming over for our holiday get together. Bring some additional layers of clothing, because I plan to also use ventilation to the max and have the windows open for a certain period of time, maybe on the hour, to also improve the circulation of air. So that's maybe a bit of a warning to my family members who are coming over. Thanks.
Thank you both so much. You've answered all my other questions.
Thank you so much.
Thank you.
Thank you to Dr. Tam and Dr. New for taking so much time to answer all of our questions. And the more answers that we're able to provide, the more people are aware of what the facts are in this. Thank you very much. And this puts an end to this press conference.
Thank you.
Bye.